Now live on YouTube.
Perfect.
Whenever
And Jake,
you're ready,
since it's
Chair.
8:59, let's go ahead and bring everyone over from the waiting room. Looks like we're ready to go, so that'll help us get started at 9 o'clock.
All right, I'll start or continue to admit all as they show up.
Thank you, Jake. Do any of the supervisors have a moment of silence for today? And Jake, please let me know when the room is empty and we have everybody with us.
All right, the waiting room is empty. Oh, someone just put it up. Continue to keep it empty.
Okay, perfect. So it is 9 a.m. Welcome everybody to the regular meeting for the Board of Supervisors for the County of Lake. Today is Tuesday, February 9th, 2021. And let's go ahead and have a moment of silence. I believe Supervisor Crandall has a moment of silence to share with us.
Yes, I'd like to dedicate a moment of silence to Tyler Banks and give our hearts and thoughts out to the Banks and the Christensen family. We lost Tyler at a very young age. I went to high school with his parents, and my deepest sympathies go out to them, to the Banks family.
Thank you, Supervisor. Supervisor Pyska, can you lead us in the Pledge of Allegiance, please?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We'll go ahead and move on. You can't see me anymore. There we go. Let's go ahead and move on to item number 4, consideration of extra items not appearing on the posted agenda. I have not received word of any extra items. Anything from supervisors or staff?
I have received none, Mr. Chair.
Okay. Hearing none, then let's go ahead and move on to approval of the consent agenda. Item number 5 for items 5.1 through 5.13. Any items from supervisors that wish to be pulled?
No.
Seeing none. Jake, could we open up the Zoom room and ask anyone from the public wish to pull an item for further discussion?
All right, I've sent an unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
And again, this is regarding the consent agenda only. Okay, hearing none, let's go ahead and bring it back to the board for action.
Mr. Chair, I'll move to approve the consent agenda, item 5.1 through 5.13.
Second.
Okay, we have a motion and a second. Johanna, if we could please have a roll call.
Okay, Supervisor Simon,
Aye.
Supervisor Crandall,
Yes.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
Thank you very much. Motion carries. We still have a couple of minutes, so let's go ahead and touch on item 7.4, consideration of the following advisory board appointments, Fish and Wildlife Advisory Committee. And we have two applications in front of us. Any comments or questions from the board on item 7.4? Okay, seeing none. Jake, if we can open up the Zoom room and see if there's any public comments on item 7.4 regarding appointments to Fish and Wildlife Advisory Committee.
All right, I've sent a unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Okay, hearing none, let's go ahead and bring it back to the board for action.
Mr. Chair, I make a motion to appoint Kirk Andrus and Gregory Juicy to the Fish and Wildlife Advisory Committee.
I'll second.
Okay, we have a motion and a second. Johanna, if we can please have a roll call.
Okay, Supervisor Simon,
Yes.
Supervisor Crandall,
Yes.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
All right, thank you very much, Johanna. And we're about to hit 9:05 in 1 second. Here we go. Let's go ahead and move on to item, 6.1. Our 9:05 item is public input. This is for anything that you wish to bring to the Board of Supervisors that is not related to an agenda item. And if you have such a comment or question, please go ahead and speak up. Jake, if we could open up the Zoom room.
All right. I've sent an unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Okay. Hearing none, we'll go ahead and close public comment. We will move on to item 6.2, and if we could just pause for about 10 seconds, we will be right on time. And it is 9:06 a.m. So our consideration of update on COVID-19 is the item, and Dr. Pace, the floor is yours.
Thank you, Mr. Chair, and good morning, everybody. This is the COVID update for Lake County, and we are continuing to see quite a bit of improvement in the transmission of the virus and the case rates in the county. And mainly today, I'm going to talk a little bit about the variants, but the main issue we're going to be talking about is the vaccine rollout. But maybe Sarah can start with sort of the data and kind of the update on where we're at, and then we'll go into these other things.
Good morning, everyone. I just have a quick update, and like Dr. Pace said, we continue to see similar trends that we reported on last week. In California, testing remains relatively high, though the 14-day average has decreased. The good news on the right is that we continue to see a decline in testing positivity, down to 5.8%. Previously at a high of almost 15% just a couple or about a month ago. We continue to see the dramatic decline in new infections statewide. Just about 10,000 new cases were reported yesterday. This dark blue line is our 14-day average, and we can see that it's declining, continues to decline rapidly. We've bent the curve on the number of COVID hospitalized patients statewide. You can see this is down to about 12,000 COVID hospitalized patients yesterday, and the 14-day average declining following that. I just wanted to highlight locally what we're seeing, that same curve. This is looking at the number of hospitalized patients that were COVID positive in Lake County. So again, you can see the peak up to about 15 or 16 people were COVID positive and hospitalized in Lake County just a couple of weeks ago. And here you can see the decline. This does not include people who are hospitalized out of county, but I think this is a good indicator to look in county and the impact on the hospitals. Now just a quick look at the ICU capacity. So the number of COVID positive ICU hospitalized patients, there were about 3,300 yesterday statewide. And you can see that we're starting to have an increase in our ICU capacity statewide. All 5 regions that the California Department of Public Health designated are seeing increased ICU capacity. And then here just wanted to show Lake County ICUs. Again, you can see a couple of folks positive in the ICU beginning in November, the increase to our peak just a couple of weeks ago, and then the decline here. We've started to see a decrease statewide in the number of new deaths, about 1,500 new deaths statewide over the last week in California. So today, the state will announce the new tier designation for all the counties, and Lake County will remain in the purple tier, which indicates widespread transmission. And it has declined slightly from last week. So the daily case rate for this time period will be 18 per 100,000 population, and the testing positivity declined slightly to 6.8%. Here's the EpiCurve in Lake County. This is looking at the number of new cases per week. So in the last 7 days, we've identified about 105 new cases. Just a reminder, a couple weeks ago, I was reporting nearly 300 new cases, bringing our total case count to almost 2,900, about 107 active cases. And in the last 7 days, we've identified 3 additional COVID deaths, bringing our total to 36. This purple bar for the week of January 24th to the 30th is the week of our tier designation, that will be announced today. And again, will remain in the purple tier. And then just briefly, Lake County, about 10% of Lake County residents have received at least one COVID vaccine dose. That's about 6,700 people. And that's up from about 900 last week. That's all I have. Thank you very much.
Thank you, Sarah. So a couple things to point out there. One is that for us to get to the red tier, we will need, there's something like 90 current cases per week, and we need to get under 43 for 2 weeks in a row to get to the red tier. So we still have a ways to go, but it's a definite improvement, and we're heading in the right direction. The other thing about this is the schools, even if we're in the purple tier, the elementary schools are able to reopen if we're under 25 cases per 100,000 for 5 days in a row, and we've met that metric now. So the elementary schools that I feel prepared to open up are able to do so from the state point of view. And then a couple other just quick thoughts. One is we're seeing significant improvement here. It's looking a lot better after the holidays, but with the Super Bowl weekend this past weekend, it's possible that some of the gatherings may cause a bump. Hopefully not nearly like it was at Thanksgiving and Christmas, but that's something to think about. And the other thing is the variants that are out and about, and I want to talk about those a little bit because you're probably seeing quite a bit about that in the news. The main variant we're concerned about in the United States now is called B117, and this is the one from Britain, the United Kingdom, and it seems to be spreading quickly around the United States. There are cases in California, mainly in the San Diego area, but it does seem to be spreading. It seems to be much more contagious than the old version and potentially more dangerous. So we're just getting more information about it, but the thinking is that potentially within 6 to 8 weeks, this is going to be the predominant variety in the United States. It's replicating so quickly. There are some other ones, one from South Africa, one from Brazil, that were first identified in those places. We're not really seeing those in California yet. These are the ones that seem to not be responding as well to the vaccine. So, a lot of questions about all this, but it does seem to be changing fairly quickly. The only one that has been identified in Lake County is one that they're not even terribly concerned about. They call them either a variant of concern or a lesser level of concern is a variant of interest. And the one that's turned up in Lake County, they're calling a variant of interest. It has some of the changes in the spike protein that we worry about, but it hasn't really been proven to be particularly worrisome at this point. But I think the main thing about this is for people to be aware it is spreading around the United States. It does seem to be more contagious, and some of them are more contagious and some of them are potentially more dangerous. So it causes us to not rest on our laurels and just relax and go back to normal life yet until we understand these things better and until we get more people vaccinated. So let's talk about the vaccine, because this is really the solution to a lot of these things, is getting more and more people vaccinated. Like Sarah pointed out, we've got about 10% of the Lake County population vaccinated at this point. There's about 50,000 people in Lake County that are age 18 and over, so who would be eligible for it once their tier comes into place, and we've got about almost 7,000 out of the 50,000 now done. So we're making progress, and but it's much slower than we would like, and we're mainly limited by supply. This last week they gave us they allocated us 1,000 doses. It has not arrived yet, which hopefully it arrives today. We have about 500 doses left in county that we'll use up by the end of the day tomorrow probably. So, we're basically getting it out as quickly as we get it, and as long as the state keeps sending them the vaccine, we'll be able to keep providing it. When the supply dries up, then we're going to have to push the pause button. We're basically, in terms of the appointments, we're trying to line up the appointments with the amount of vaccine we get. So once we get the allocation, we start setting up the appointments, working on those, and then once it actually arrives, we'll open up the appointment link so that people can start making appointments. So when you try to get on and you can't get on because there's no more appointments available, there's nothing else to do at that point. We don't have any vaccine in the county to actually set the appointment up for. So you just have to try back again in a couple days. Right now, we have appointments open, the link is open for today and tomorrow, and that's all the vaccine we have. Hopefully we get this supply in today and we can open up for Friday, Saturday, and then next Monday. So the tier system, this is the way we're trying to help the right people get to the front of the line, and an extremely imperfect system. We're working off of the state recommendations. At this point in Lake County, the 1A phase, which is mainly the healthcare workers, the nursing homes, the emergency workers, those kind of folks, they're pretty much been offered all the vaccine, and the ones that wanted it have gotten it. Many of them have gotten a second dose. At this point, we have about 1,000 people that have gotten second doses as well, and so are completely vaccinated. The teachers and the K through 12 staff have all been offered vaccine as well, and the ones that wanted it have gotten it. I think there's somewhere between 60 and 80% of the teachers and staff have accepted it. So we're now focusing on the elders. Also, just to say, with the educators, we did not include the childcare and preschool or the college, because that's a big group of people that would need vaccination, and the colleges are currently not open and are pretty much able to do most of what they do remotely, and most of the childcare and preschools have been able to be open, and there's been pretty minimal outbreaks in those settings. The younger children tend to not be as likely to get the virus or to transmit it to the adults or to have outbreaks. And so we've been kind of letting those folks be so that we can focus on the elders. State and locally, there's a lot of interest in helping to address the health disparity question. The concerns about the higher number of cases in the Latino community and the Native American community we've talked about here before. And there's getting to be a big push to try to focus on these two communities to help them get vaccinated so that we can prevent the hospitalizations and death that seem to occur with that. The Native American community has had pretty good access through Tribal Health. Tribal Health has a separate supply of vaccine through Indian Health Service, and so those folks have been taken care of. The Latino folks are not so much. We're just trying to sort through the data, so we don't have good data yet, but the groupings that we focused on the Latino population tends to be underrepresented in those. So I suspect we're going to find fairly low numbers of them. So we're starting to try to get a strategy to focus on the farm workers and some of the other essential workers in the Latino community that to get those folks vaccinated, because we think a lot of what's happening is they're out working and bringing home to their families, and that's where the issue is. So that they're going to become another focus here in the next week or two in terms of the vaccine prioritization. So again, well, one other thing about this is that we talked last week about a vaccine ethics committee. The first meeting is going to be this afternoon, and they're going to look at some of these details and look at some of the strategy and sort of provide some input and kind of serve as an advisory role to me as we're making these decisions on how to go forward. But again, the current focus is getting the rest of the 1A folks that for whatever reason didn't get it before, and the teachers and all, and then focusing on the elders, and then we're going to start focusing on the Latino community now because of the much higher incidence of the disease and hospitalizations and things in those communities. So again, the main issue is supply, and the state has not gotten any better about guaranteeing more doses or looking beyond just a week at a time. So we're doing all we can do, which is 1 week at a time. When we get an allocation, we start preparing, and then when it actually arrives, we open up the appointments, and then we get it out within the next week. Sutter and Adventist were getting pretty good supplies before. It seems like their supplies are not as consistent, and so they were putting up some big stand-up vaccine sites, and I think those are having to slow down now because of supply issues as well. But they're a big part of why we've been able to get so many people vaccinated so quickly in the county. The state's really recommending that we focus on speed, getting it out as quickly as possible, which we are doing as well as we can. We can't do it much faster. Like I said, we're going to run out by tomorrow afternoon if we don't get some more. Fairness, so this whole issue of justice and health equity and disparity, and then preventing death. So really getting it into the populations that have the highest risk of dying if they get ill, especially with this variant coming through. There's increased concern about getting it into the arms of the people that are most at risk of dying. At this point, all the nursing home residents are vaccinated. So luckily that community is taken care of. We're going to be switching the models. So we've been working on Tuesdays and Wednesdays, and then Fridays and Saturdays, Tuesday, Wednesday in Lakeport, Friday, Saturday in Clear Lake. We're going to switch that, and we're switching to a drive-through model. The numbers now that we're doing the second doses, and we're trying to do 250 a day or so, it's just the numbers are too big for these buildings. And luckily, we got through the first month with some of the nasty weather that we've had the last couple of weeks, which would have been a problem. And now so starting next Monday, we're going to be working on a whole different model, which is a drive-through. So people that have come and gotten them in the first month or first couple months here, and you're going to get your second dose, it's going to look different. It's going to be in a different location. So you just need to be paying attention. We're going to try to reach out to everybody and make contact, but if we can't get them through the phones or whatever, and you show up at the other site, we'll have a sign there that tells you where to go and what to do. But hopefully we'll be able to get in touch with everybody and redirect them. They're still going to be in Lakeport, and Clear Lake is just going to be a different location. And again, if you don't have an appointment, don't show up, because we're only working with appointments. This is how we're trying to manage the expectations and trying to keep it moving smoothly. We've been really, really fortunate. Anytime I've been going over pretty much every day that it's been open, and anytime we're there, about half the people are paid staff, either public health staff or other folks from other parts of the government system that have been redirected to help us at this. But about half of them are volunteers. So whether it's the retired doctors or nurses that are giving the shots, or folks helping with traffic control or registration, there's some real solid volunteers that have been helping us almost every day with the registration or with cleaning the chairs in between people. So, I really want to give a shout out to all the help we've been getting with this, because with a small county like Lake, we just don't have the staff, and the fact that the community just keeps showing up day after day, and it was cold some of those days the last couple of weeks, and we had a little trouble with the heat one of the days, and no complaints. They just keep showing up and helping us out. So really, I think folks in the community ought to be very grateful of your neighbors for helping keeping this going, because we couldn't do it by ourselves. So again, the appointments, we have shifted it. So last week we shifted it to where the appointments are public facing. So if you go onto our website, you'll get a link. And if you qualify, which is if you're 65 or older, you qualify, then you can go click on that link. And if there are appointments still available, you can make an appointment there. If it's something that you can't, you don't have internet access, or you don't have the ability to navigate through the internet, there is a phone number on the website that you can call, and some folks there will help you. If there are no appointments available, they don't have any secret stash of appointments. So there's no value in calling them. If you try it online and it says no appointments available, don't call them, because they don't have any either. It's basically just helping people who can't navigate the system. We are moving to a new software system probably in a little over a week, and that the state is mandating that we do. So again, just another one of the changes that comes down. That one will have its own call-in center. It will have bilingual people on it, and so there are going to be ways to do it, but it will be a similar process. We'll make the links available to the public. Public can go ahead and make the appointments till they're filled up. And then when you come to the site, we'll make sure you have an appointment. We'll check your ID. We'll make sure you actually qualify. If you don't qualify, we'll send you off and until your time comes, and we'll make sure you're a resident of Lake County. So, at this point, today and tomorrow are open, and once we get the supply in, Friday, Saturday, and next Monday should open up then as well. So hopefully that comes in soon. So that's basically what I was hoping to talk about today. I mean, from a surge point of view, we're doing really well. It's very reassuring to see how things are going. I think the risk within the community is much, much lower than it was 3 or 4 weeks ago. The variant gives me a little bit of anxiety, but we'll just have to see how all that turns out at this point. The schools can start moving forward with the K through 5, I guess, can open with the current setup as the schools have their plans together and are ready to do it. The vaccine rollout is going well as can be expected given the amount of vaccine we're getting. There is pressure on the state to get more, but the state doesn't seem to have any either. And so there you have it. And, I really just want to encourage people to be as careful as possible now and not really just go back to normal life, because I think this variant could change the equation in the next couple of weeks. We'll be learning more as the information unfolds. And just the last thing to say is just so we're going to do this presentation in front of the Board of Supervisors every Tuesday. We'll do a video presentation of a similar kind of report on Thursday that will be put on Facebook and I think YouTube as well. And then next Tuesday, there's not a regular board meeting, so we'll go ahead and do that. So basically twice a week now, we'll do one of these video updates just to keep people going. Once it gets more stable and less changes every couple days, we can probably go to less often, but at this point, that's the sort of the strategy. So thank you very much.
Thank you, Dr. Pace. Any comments or questions from supervisors? Supervisor Pyska.
I just want to thank you, Dr. Pace, for your help with the seniors that were having difficulty getting appointments through the senior center. I've heard of quite a few, not directly through me, but through other supervisors that were able to get their appointments. So I really want to thank you for that.
Great.
Thank you. Supervisor Scott.
Yeah, no questions for me either today. Just your team is absolutely rocking it. When I reach out to them, they get right back to me. You guys are doing an amazing job. Just keep up the good work.
Supervisor Crandall.
Yes, I agree. You're doing a great job, doing what we can with the situation. And I just had a question about, so we're doing the 1,000, we received 1,000. Is Adventist and Sutter still receiving 1,000 as well, or is theirs, we don't know the number?
Yeah, I don't know the number, but my understanding is they're not getting nearly what they were getting before. And we've been in conversation of we can share some and we don't really have any extra right now. And so so I think the numbers are going to decrease on how much vaccine we're actually getting out every week now because they're getting less. They were getting a lot. I was surprised how much they were able to get the last couple of weeks. And I think what's happening is the corporate gets a certain amount and then it gets redistributed amongst all their different hospitals. And I think, they're not getting as much down in Lake County now.
Is the Mohawk, are they assisting the folks that are like, they're not using the internet? I have many people that call me about this. They're calling. When they're calling in, is the folks, are they helping them get signed up for their appointments, or is there another entity that we should be directing them to get help online?
There's another number. So it's, we basically are having some of the folks at social services are really helping us to do this. And so they're the ones that are helping people get on there if they aren't able to do it. So, and they're particularly good with the elder folks, and patient helping them get on. So the number you can call is 993-4644.
Okay, thank you for that.
993-4644. And so this is not for people that can get online and they're frustrated because they're not getting an appointment. But these folks will help people that do not have internet access or just can't really navigate those kind of online appointment situations. Like, my mother would never be able to do that. So it's, if you have a family member that can do it, that's great. They can do it. But if not, if they don't have that, then this would be the number to call.
Thank you for that. And I just have one last question is, in the numbers of people being vaccinated, is this a collaborative amongst hospitals, county, and tribal health? Are those their numbers as well? These are
the numbers from the state of everybody with a Lake County residence that's been vaccinated.
Okay, thank you.
Supervisor Simon?
Yeah, Dr. Pace, you just want to, the same as you did, all the volunteers, your department and everything. I know this is a challenge from the supply end, but I do just want to say thank you very much. I know after last week's call, we did get some seniors that probably reached out to every one of the supervisors, but I know I had a few folks that we passed on. I know that getting the information out there has been, as efficient as possible. But I do want to just say thank you to you and all the volunteers working through this situation. Making sure that as the changes happening, I know you talked about them today, the potential drive-through and some other stuff that's going to be happening. Just want to make sure we get it out to the communities and communicate that very well. I know you've done that and just continue down that path. And also wanted to just say that I did get reached out by a couple of seniors that were able to go get their appointments at the senior center in Clear Lake, and they passed on to me that they wanted to thank you for the experience they had. They weren't sure in this environment that we've been going through all this time, but they felt safe and they were able to get through it. So I just wanted to pass that on to you and all the volunteers that are doing the shots when you're able to get them done. We understand there is a challenge, probably the next 4 to 8 weeks. The supply issue is going to hopefully smooth out. We'll continue to push from our end, but just for folks to be as patient as possible and continue to reach out to us, and we'll continue to try and move in a positive direction for our community. So thank you, Dr. Pace, and all the volunteers that have worked on this for the past 10 months.
Thank you, Supervisor. So I wanted to talk real quick about schools. I know it's not within our own jurisdiction, but I know and feel and understand the impacts that schools being closed and being virtual has had on our students and our families. Our families, some are forced to stay home because they have young children that they can't leave alone at home, meaning that they've had to drop their jobs, become unemployed. We're seeing the statistics, unfortunately, coming out for that women are being absolutely more impacted than anyone else by this. The unemployment just for last month, 80% of all unemployment was for women. That is not a positive note for what we're doing. Obviously, there's inequity that still exists within our rules and within our society, and it's showing its ugly head with all of the things that we're doing. And there's good intentions, but the outcomes are still very much the same as in the past. Also, there's two sides that are hesitant to go back to school. I find that a large majority are more educated and middle class who have the ability and capability to continue doing things at home, helping their children at home. But it's hard to teach your child algebra if you don't know algebra. It's hard to teach your child to read if you don't know how to read. And those things are very important to make sure that we don't leave our children behind. Already our numbers were not looking great in our communities. And I've spoken to some of our educators and some of our superintendents, and it does not look good as far as what's happening now. We are losing more people 15 and up that possibly will never go back to school. And that is a scary situation to think how that will impact us in the future. Yes, I know that there's impacts of potential deaths, but there will be some long-term effects to our communities and to our economy because of some of the things that are happening right now. And on the other side, you have those who have intergenerational houses who are also worried about going back to school because now you're sending your kid back to school and you have a grandparent and parent and uncles and others who are living all in the same household, which creates other complications. So none of this is easy, but we have to find a way. And I'm just going to say it as an individual, not as the board, but as an individual father, as an individual supervisor and a person in the community. I am absolutely in favor of reopening our schools and providing the safety measures necessary for our children to go back. And so anything that I can do, I've already reached out to many of the educators out there, anything that I can do to help, because there are some unseen problems that I think we take a lot for granted, such as internet. And for instance, we just said, if you don't have internet, you can reach a number, but we finally got to saying the number. It's because that's how much we take it for granted, that it's just that easy to access those things. So I appreciate that we gave the number, but there are some people in our community that really have struggles on accessing some of these things that other people have absolutely simplest of accesses to it. There's some unknowns as to what's going to come in the next couple of weeks. The state has been discussing about changing the tiered system. My guess is that will be a benefit to allowing schools to open. I think that's what's going to come down the pike. But there is nothing set in stone other than conversations have been had as of late for the tiers to be changed once again. And it's all a learning process. Everything was done in again, good intentions. But we're learning more and more as to what the overall impacts are on the decisions that have been made, and I think that those will be coming down. Preschools and childcare. I wanted to bring this up in the sense that yes, they have been active throughout this whole time. Yes, there's been minimal. I don't have the exact data, but I haven't heard of any large outbreaks happening at childcare or daycare areas or preschools. But at the same time, I would suggest that possibly some parents are concerned about bringing their children to these daycares or preschools, which prohibits them from going back to work. And so there's a correlation between getting our people back to work and getting our kids back to school that's, in my opinion, is not a chicken or egg theory. It's literally the children have to have a place to go before we can get parents back to the workplace. And so I think that reviewing that and trying to figure out when and how we can get to those sectors is going to be important. I'm glad to hear that we're getting more vaccines. We've been working on that. We've been told that it was coming, and I'm glad that it's not wasn't just words, that we are seeing it in action. 1,000 is great. I sure hope that we get that full amount that was requested. I'm still concerned about the disconnected or those that are concerned about not taking the vaccine. Can't force them to do it, but I'm concerned about what that future looks like. I just had a conversation with Tribal Health. I wanted to get a little bit more information, just to better understand their process, who their clientele are. From what I understand, about, I don't know, 75 to 80% of all Native Americans in the county are being seen by Tribal Health. So it's definitely not all, and hopefully they have another primary care provider outside of Tribal Health. But it was something like 25% are agreeing to take the vaccine. And I know that historically we have an issue with the trust of healthcare when it comes to minorities, which is an unfortunate situation that we're seeing again pop up. And so we have to figure out, I know that we have Konokatai that is working on this, and I hope that they're not just working on the decreasing of cases, but also working on informing that population on the vaccine, the benefits, and just the facts of the vaccine. Because I think that that number is dismal, and if it's possible to increase through positive messaging and factual messaging, that maybe that can change. But I'm going to make a guess that we're going to possibly see the same situation when it comes to our Latino communities. And so hopefully LCOE, who has the contract with the Latino communities, can do that same level of work, not just about decreasing our cases, but also increasing the trust in the vaccine as well. I do appreciate the hard work that's going into that. I appreciate that we're going to go to an outdoor drive-through. I'm taking it, because I haven't been informed on the specifics of it, that they go through, get the shot, and then park for 15, 20 minutes, and then eventually they leave once we've decided that there's been no reaction or anything like that. I see Dr. Pace nodding, so that seems to be the case, because I know we were worried about that at first, because we did speak about doing a drive-through model at the very beginning, but then went with the brick and mortar. But I do want to say thank you to those who are running the senior centers. There's been a lot of thank yous for those dealing with the vaccines, but I know the senior centers have also been communicating with all of their folks that they support through their programs. I know like all of us, got contacted by seniors or others advocating for seniors, contacted the senior center, and they were on the list. They have a lot of people to call, and they just hadn't gotten to some of those people already, but they did in a very short time. So definitely want to show appreciation for those who are working at the senior centers, who are doing a program that they never thought that they would probably be doing and helping out with, but happy that they're there to provide that assistance. So I'll stop right there, but I'm really hoping that we'll see something coming from the state with a new update on the tiers, and see what that does to us and how that can help us move forward. Any further comments or questions? Supervisor Scott?
You made a comment about schools. I think people need to be making sure that they are paying attention to their school board meetings. So make sure you're getting online, finding out when your local school board meeting will be meeting, so you can have your voice heard when it comes to your children. I know Lakeport Unified will be meeting this Thursday at 6 o'clock via Zoom. So make sure that you're there and having your voice heard.
Okay, thank you for that. Seeing no other supervisor with comments, let's go ahead.
One last, Supervisor, Mr. Chair, one last comment.
Yeah,
I just want to bring up Dr. Paisley. I did talk to you about this earlier in the week, but also wanted to, I know we talk about, you know, all of our ethnic groups and everybody, we're looking at the disparities, but also want to bring up, you know, and hopefully we'll see some changes in our disabled folks in the county. You know, I know there are a lot of folks and have some concerns that folks have disabled folks in their house. They were, you know, either a teacher, they were able to get vaccinated, but then they have someone who's vulnerable in the home that they'll be coming home to. So hopefully that's taken into consideration when they kind of revamp this situation, because ultimately we want those educators to be able to go to work and not have to worry about bringing something home to maybe a disabled family member or somebody else. So I know it's still a challenge. It all comes down to supply. But hopefully, and when we're looking at the tiers, our disabled community in Lake County is taken in consideration when we work that through. So, and hopefully throughout the state also, not just Lake County. But I did want to mention that there are all kinds of issues that are constantly popping up. But those are folks that can't speak for themselves or advocate, and we need to be always moving forward with that from the board level. So thank you very much for at least hearing that and taking that in consideration.
No.
Yeah, if I could, Supervisor, just to update on that, there's been a few changes. So the state, they gave some conflicting advice on how to deal with in-home caregivers, with people that were family members. So we really focused on folks that were providing care in multiple households so that they wouldn't be spreading the virus around. But the state just came out, I don't know, a few days ago with some new guidance that really encouraged vaccination of family members who are caring for disabled folks. And they also, they had specific categories. And so if people go on the state website, the CDPH website, they list which illnesses they feel like people are at higher risk from having real problems with the COVID. And so, you know, they can go on that, and probably the best way to do it is to get a note or something from the provider and let us know, and we can help them get that. The other thing is that the disabled community, so the people that are not 65 and older, so under 65, but that have different kinds of chronic medical illnesses, they need to be 18 or over, so between 18 and 64, and to have certain medical illnesses, they're going to be in the next grouping after some of these essential workers we're talking about. This is the way the state's kind of rolling it out. And so, you know, it's kind of confusing, and they're sort of moving it around a little bit, but probably in the, you know, maybe within a month or so, we'll be able to start really approaching those folks. It just depends on supply.
All right, thank you, Dr. Pace, for that clarification. Thank you.
No, thank you both. That's an important one to bring up. And in fact, I forgot to mention that the tiers overall have changed for the state. If you look at the state covid19.ca.gov/vaccines, they've gotten rid of a lot of the details once you get past the 65 plus. Now it just basically says age after that. And so there's definitely some updates that have been coming down the pike, and as Dr. Pace alluded, some of those changes as well. Also wanted to mention, I'm not sure if I mentioned it last week, but in my conversation with the state, the reason that there's a disparity between certain counties getting more vaccines than us as far as percentage of population is due to the fact that it was based on skilled nurse facility or senior home facilities where they needed to be provided care. How many of those people did we have in our population, and the amount of healthcare workers that you had in your population. And so obviously there would be certain areas where there's universities where basically where we're sending our folks to get healthcare is most likely where they're going to get a little bit more because they obviously have more healthcare workers. However, once that part of the state is done, then it's going to be based on age groups as far as what we receive next. And because we have the largest percentage of population of 65 plus, we would be seeing an increase in the amount of doses that we would receive compared to some other areas that might see a decrease. So just kind of wanted to relay some of the information that I learned from the state. They have a formula, just doesn't always fit what exactly we want, but at least now we can understand what their reasoning is, and it's always good to have that. Nothing further from anyone else. Let's go ahead and open up the Zoom room, Jake, and we're going to start with Susan Cronus, who has had her hand up and waiting patiently for a while.
Oh. Am I unmuted? Can you hear me?
Yes, we can.
Okay, thank you. I have 3 questions, which is unusual, just 3 for an attorney. But anyway, who is the chair of the ethics committee? What is their contact information? And is it a public meeting?
Gary, would you like me to respond to that?
Sure, that'd be great.
So the Ethics Committee is just in the process of being formulated. Its first meeting is today, so we don't have the answers to those questions yet.
Who is on the committee?
We're going to meet with the committee first and discuss with them what their process will be and whether or not they want their identities known or prefer to operate confidentially.
Okay, and when will that information come out after the meeting today?
Well, as I said, it meets today. So as soon as there's more to know, we will let you know.
Okay, and how will that come out?
Susan, I don't know the answers to these questions. The committee hasn't met yet. We're going to meet with the committee and make those decisions today.
Okay, thank you.
Thank you, Susan. And Jake, let's go ahead and check to see if there's any further comments from the public in the Zoom room.
All right, I've sent an unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Good morning. This is Bart Levinson. Yes, I was going to ask the same question about the Ethics Committee. How will the public be able to participate? So I look forward to hearing that answer. Also, I wanted to ask Dr. Pace, when Sarah was giving the statistics in her reports, she was saying, as you can see, and I just wanted to note that some of the participants in your meetings now by Zoom are on phone and can't see the graphs that are being presented. So if Sarah could please also say the numbers. And where, Dr. Pace, you said the public should look to your Tuesday Board of Supervisors presentation and a video on Thursday. Could you please be more specific about where exactly the public should look for the video on Thursday and where those who don't have access to a computer should be checking in?
Matthew, could you help with that?
Yes, as of right now, the videos are available on the Public Health Lake County Facebook page and also the County of Lake Facebook page. They're recorded on Thursday afternoons and then edited by our videographer and published as soon as possible thereafter. So usually they'll show up sometime late on Thursday evening. So some people will see them for the first time on Friday morning. We have heard from our librarian that they have Chromebooks available that can be checked out for periods of 3 hours. So that's applicable for the Board of Supervisors meetings on Thursdays, and would also be possible for people to go to the libraries and be able to access those update videos. And I would definitely recommend going on Friday morning if you're wanting to access it via one of those meetings.
And I need to interrupt real quick, and I'm sorry to interrupt you, Matthew. We need to just take a quick little break. We've lost our county council, and I do not want to keep a meeting going without county council to check in. I do not want you to go away, Matthew. I want you to finish. I don't mean to interrupt.
Jake, can you alert me as soon as Anita rejoins the room? And so, Mr. Chair, you want to take a 3-minute break or something like that?
I do see her on the phone. Is she available on the phone?
Yeah, I do see her here, and I'm checking in with that. I'm sending a mute request. See what we have here.
And I apologize to everyone for this. But Ms. Grant keeps us out of trouble. Or maybe better to say, she keeps us in line.
That's her goal anyway.
Yes. I say we just take an official break. I apologize again for the interruption. That way we can leave Jake and to try and figure out how to get this resolved, and we can get Ms. Grant back. So let's go ahead and come back together at 10 a.m. We have 10 a.m. and just going to check, Ms. Grant, we still have you with us?
Anita, if you...
Hello?
There you are.
There you go.
Yes, I'm not appearing the way I normally do, so I had to come in as a participant. Okay, thank you.
Yep, thank you. All right, let's go ahead and continue. We had Matthew responding to a public comment. I, again, apologize for the interruption, but if we can either start over with your response or continue from where you left off, that would be great.
Hi, yes, this is Matthew Rothstein, Deputy County Administrative Officer. So I'll just recap. So we had someone ask how they could watch the Thursday COVID-19 update videos, and those are called COVID-19 Emergency Operations Situational Update videos produced by Dr. Pace. Those are recorded on Thursday afternoons and posted sometime late Thursday evening. So they can be accessed usually Thursday evenings via the Public Health Lake County Facebook page and the County of Lake Facebook page. And they're also posted to the County of Lake YouTube channel. The YouTube channel has the benefit of closed captioning functionality. And there is also, usually after a period of time, auto translation features available on that channel. So it's really been a good option for a lot of people. Certainly we are concerned that some do not have internet access, and our librarian has been generous to let us know that there are a limited number of Chromebooks that are available at the Lake County Library locations in Lakeport and Clear Lake. So those libraries both open at 10 a.m. on Fridays, and you can check out a Chromebook for a period of 3 hours. The Lakeport Library branch can be reached at 707-263-8817, and the Clear Lake location can be reached at 707-994-5115. Thank you very much.
Thank you very much. I wanted to respond to two of the questions, and this has been brought up about the Ethics Committee. My opinion of the Ethics Committee is that the committee members themselves remain anonymous because of the potential for lobbying and advocacy, which is exactly the type of pressures we're trying to get away from and move towards just what makes logical sense. The results and the decisions made at the committee needs to be made public. And again, that's my opinion on what I would like to see out of it, because the conversation that the Ethics Committee came out of the pressures that had already been impacting the vaccination rollout. And how do we ensure that we're looking at a very fair and equitable way to make sure that we're doing what's right. And so that's, again, my opinion on that, and open that up for further discussion with the board, but just wanted to speak on it. I see Ms. Hutchinson came on, so might have a comment on that.
Yes, so today we would be discussing with the committee its process. And what Dr. Pace and I had envisioned originally is that requests for consideration, for reprioritization of the plan for rollout of the vaccines would come through Dr. Pace and be given to the committee to ponder and make a recommendation. We were not envisioning that the committee would receive requests from any outside source or county department or what have you, because it would be never ending. So, but when Dr. Pace is facing those questions, it was our vision that he would forward those concerns to the committee. But again, having not had any level of conversation with the committee yet, we want to get their input on how they believe it should work.
Thank you very much for that. Because I brought something up, anyone from the supervisors want to comment on this, or shall we move on in public comment? Okay. Jake, let's make sure the Zoom room is open and available for further public comment.
I've sent an additional unmute request out to the Zoom room floor.
Thank you, Jake.
Good morning. This is Bart Levinson again, continuing with the question that I asked previously. The question is, you, Carol Hutchinson. So you expect the public to communicate to Dr. Pace anything that we would like expressed to the Ethics Committee? Is that correct?
Mr. Chair, do you want me to respond?
Please.
I think the message everyone needs to get here is the committee hasn't met yet, and these details will be worked out with the committee.
And I would say that at this moment in time, reach out to your supervisors and talk to us at this moment in time. Ms. Fulton, you were next.
Yes, thank you. I appreciate this discussion. And I did send a question to Anita, but now I'll give it to the whole group. Since this committee is being formed under the authority of the Board of Supervisors, is it truly legal to have the members of the
Ms.
committee?
Fulton, I'd like to correct you that this is not under the Board of Supervisors. It's not a committee created by us or by the chair. It is a committee created by our public health officer who is in charge of this emergency.
Thank you, Supervisor Sabatier. However, with all due respect, the umbrella organization is the Board of Supervisors, and the County Health Department falls under that umbrella. So my question remains, how can any county-affiliated committee have members whose identity is not made public? I'm not disagreeing with the concept that was put forth at all, but I'm wondering if in fact, and this I'm sure Anita will weigh in on, but how could any committee formed under the umbrella of the Board of Supervisors be considered a secret committee? Thank you.
And I may have made a mistake and opened my mouth by stating my opinion, because that may not actually be the fact. I'm sure that Anita will let us know, and with the meeting happening later today, that more information will be provided.
Mr. Chair?
Yes.
Thank you.
This is Anita. I don't quite understand ostensibly any committee. Your board has individual committees that help you with various limited issues. Here it's my understanding that Dr. Pace wanted the assistance of a group for a very limited purpose to review certain things. The efficacy of the group, depending upon what the governor later says in terms of priorities, may or may not even have much significance. But if it does, this is a group that your board wasn't asked to create, wasn't asked to approve. It's not created under your umbrella. It is created, I believe, at least that was the intention, and perhaps that needs to be made more clear, that this is part of Dr. Pace's ongoing efforts to improve the efficacy and efficiency of the entire vaccination process in his role as public health officer. I'm not quite sure what the reason for not allowing the identity of the members. There may be reasons, I'm just not aware of them. I think that the last meeting, this was just broached as something that may happen. It sounds as if there's a great deal more in terms of how this is going to gel out, but I don't believe that this was technically created under your umbrella any more than you have a supervisor who has a blue collar committee that wasn't created under your board's umbrella. You have another group that Dr. Pace put together that has disparate people that he created that was not part of your board's creation or even suggestion. So I believe that's how it's operating here. But if my facts are wrong, then of course my opinion would change.
Thank you, Ms. Grant.
Thank you.
Thank you. Jake, any further public comments?
I've sent another unmute request out to the Zoom room floor to check.
Yes. One last question, please. So for people who do not have computer access, the new number that Dr. Pace presented today, 993-4644, is that the number of social services is that the number that the public now should know to call if they need information about the vaccine and don't have a computer?
Yeah, thanks for that question. The number, if people need information about the vaccine, they should call 211. That's the first step, because that's where the basic information that we're giving out is. If they need other information about the vaccine or vaccination possibilities or things like that, they should call the MOAC line, which is 263-1874. The number that you mentioned, 993-4644, is specifically for people that qualify for the vaccine, so 65 and older, who need an appointment, but they can't deal with the computer. So those are generally, I mean, older folks that don't have computers or don't have the wherewithal to kind of navigate through an online appointment strategy. These folks will help them make an appointment. So it's a very specific number, and some social service employees are really helping us out by doing this. So we'd appreciate it if people don't overwhelm them with kind of other calls, or because you're upset because there's no vaccine available, or you want to get on the ethics committee or whatever the question is. They don't really have control over that. What they're really doing is helping us support the senior community who would not be able to get an appointment otherwise because of internet limitations.
Thank you, Dr. Pace.
Thank you. And would it be possible, Dr. Pace, for you to put out a statement in the local press just saying exactly what you just said so that it's more widely available?
Sure. Yeah, we'll do a press release probably tomorrow. I'm pretty sure that went out last week as well, some version of that, but it sounds like there's still some confusion. So we'll do that again this week. Thank you.
Yeah, and
thank you.
Agree that press release did go out, providing all the different ways that you can get an appointment, both for testing and vaccinations. Okay, Jake, any further public comment in the Zoom room?
And I followed up with a additional request to unmute.
Thank you.
Julie Colfax here. Can you hear me?
Yes, Julie.
I am curious, being 12 months into this pandemic, I know we've looked repeatedly at the number of deaths and the positivity rate from the COVID virus itself. I'm curious to know if public health and or other providers have considered the dramatic impact the situation has had on mental health and even the death toll from an increase in suicide rates that's happened because of the changes in lifestyle, and taken that information into account when we talk about choices being made based on virus positivity, that there are sometimes other consequences of the disease as well that dramatically affect both our schools and our work and our community life.
And if you'd like, Dr. Pace, I can respond to that, or if you wanted to respond to that.
Oh, sure. No, I'm happy to respond to it. Yeah, I mean, you bring up really important points. We consider that all the time. It's definitely a risk-benefit kind of balancing act that we're working with all the time. Again, you know, there's the state regulations about what's allowed to be open and what's not allowed to be open, which we are following. And there's a lot of thought that goes into that. And then there's the reality on the ground. So like right now, for example, the elementary schools are able to be open, and but there's a whole issue with that, because once they open, then they start having to deal with positive cases and positive teachers and all that. And so it's not just a simple fact of restrictions, remove restrictions, or, you know, even in the areas, not so much here right now, but in other parts of the country, when the restrictions on restaurants and bars are lifted, people are often reluctant to go back because of the concerns about the virus transmission and everything. So we're thinking about that all the time. We're doing what we can. That's where the hope is that the vaccine getting out is going to help us get back to a more normal lifestyle. So the other impacts of, I mean, I agree with Supervisor Sabatier. The schools being closed for this long are really problematic for society. And I think a lot of kids are going to suffer from that it's going to be very, very difficult. And, but again, you know, all fall, the schools were able to be open. They just, they didn't feel safe. There was issues with getting all the staff comfortable and getting the protections in place to prevent significant outbreaks was what was going on. And so now we're moving into another phase where we're really trying to put those supports in place to get the schools to be able to open as soon as possible. But you're absolutely right. And I think we're going to be kind of calculating the cost of this in the coming months and years. That's going to be a lot bigger than we ever realized in terms of mental health and in terms of substance abuse and domestic violence and all kinds of things.
Thank you very much for that answer. I would love to actually have some information in some of your reports as well about those numbers as well, about symptomology. We're seeing increased maybe referrals for behavioral health services, and or, you know, what does the suicide rate increase look like?
Okay. And we do have Director Metcalf here. It looks like he unmuted in order to respond as well to this. He would definitely be the main source of information for that.
Yes. Good morning, Mr. Chair, members of the board. My name is Todd Metcalf. I'm the director of the Behavioral Health Services Department. And to respond to what Julie was mentioning, yes, we are definitely seeing an increased need, not only in mental health services, but substance use disorder services as well. And statewide, nationwide, studies are showing and proving that because of the pandemic, there is an increase in anxiety, depression, post-traumatic stress syndrome. There are all sorts of mental illnesses related to this pandemic, and we're doing the best we can to respond. But it's problematic because of our staffing issues and what have you. But yes, this is a real thing, and our department is certainly significantly impacted by it.
Thank you, Dr. Metcalf. I will add that you said something about deaths. We've actually had the lowest death count in quite a long time, according to California Department of Public Health. We had 659 in the year 2020, and the lowest before that was 2014 with 770. So that's 100 more than what we experienced. And I think that shutting down stopped a whole lot of other things like car accidents and other incidents that we would typically see that we're starting to see again, because a lot of people are going back to their normal activities, which you know, we've had some very unfortunate incidents in the recent past here. But at the same time, there is definitely, I know a statistic that Director Metcalf provided to me was a 500% increase in substance abuse calls to his department. So there definitely is an outlying impact that may not show up on our statistics at all times, but I appreciate the comment. And it's being discussed as well, so I appreciate that. Supervisor Pyska.
I think we all recognize that this is really a difficult time. It's a difficult time for our families. It's a difficult time for all of us. There's really nothing easy about this. We had a very close personal friend commit suicide a few months ago because of this pandemic and because of mental illness and added anxiety. It's very difficult, and you know, we are all in this together, but you know, it's helpful to bring this up and to highlight you know, the mental health, behavioral health, substance abuse, all of these things are part of, you know, what we're dealing with together.
Thank you, Supervisor. Any further public comments?
Mr. Chair, can I just add one thing? I got one of the phone numbers wrong. So the MOAC line, I transposed a couple of the numbers. It's 263-8174. I said 1874, so it's 263-8174. So I just want to correct that. Thank you.
I appreciate that. Thank you so much. Okay, Jake, I'm taking it that that was out there for anyone to unmute and ask a question. Is that correct?
Yes, I did follow up with an additional unmute request.
Okay, so it looks like we are done with public comment, bringing it back to the board. Any further comments before we finish this item?
Yes, I have a comment.
I'm sorry, we're done with public comment at this moment in time. And
thank you.
Since you had a chance, we definitely did not skip you accidentally. If you have any further questions, please either email public health or email your supervisor, and we'll make sure to get you an answer to that question.
Thank you.
Okay, thank you. Anything else from our supervisors? Okay, let's go ahead and move on thank you very much, Dr. Pace. Appreciate your time and your work. Let's move on to item 6.3, our 10 a.m. item. Consideration of A, resolution amending resolution number 2020-133 to amend the fiscal year 2020-21 adopted budget by adjusting reserves, fund balance carryover, revenues, and appropriations. And B, resolution amending resolution 2020-134 to amend the position allocation for fiscal year 2020-21 to conform to the mid-year budget adjustments. Ms. Hutchinson.
Thank you, Mr. Chair. So I have the good fortune of being able to introduce this item today, but staff will take it from here in just a couple of minutes. And I am also really fortunate to have such a capable staff. And Stephen Carter, our finance lead in the administrative office, has led all of the processes that it took to put this mid-year budget review. And Sarah Schuchart, our administrative analyst, supports him to a great extent. So I'm very grateful to both of them. As you know, there are three formal times each year when your board considers your budget. And this is the middle one. This is mid-year budget adjustments for fiscal year 2020-2021. The next opportunity will be recommended budget in June for 21-22. And then final recommended budget in September. At this juncture, ordinarily the changes are somewhat minimal as they are this year. The changes that we're proposing to you today are all items that you should have anticipated because staff has been carrying out the direction of your board. And so the changes are for the most part linked to that. In a few minutes, Stephen is going to go over all of what is proposed in detail. But we're going to start with a cannabis spending policy review. As you remember, when you adopted your cannabis spending policy in 2020, it was agreed that you would review it no less than 3 times a year. And so this is one of those times. And so Patrick Sullivan will go over that policy and then move on after your board reviews that, move on to the proposed cannabis grants that are being recommended in this mid-year budget. We had a second round of cannabis grants and we worked with our committee, including Supervisor Scott and Supervisor Crandall, to review and formulate recommendations for the internal grants that we're asking you to approve today. And so before I wrap up my comments, I also need to put out a big thank you to the Auditor Controller's Office, another very vital department head in leading this process. So thank you, Kathy, if you're here. And then, of course, to our department heads. This comes together through the cooperation of everyone. One of the neatest things about working for Lake County is that we all work together so well. So the work of department heads and their staff in putting this together is greatly appreciated. And a number of them are here in the Zoom room with you today in the event you have questions about their budgets. And so with that, I would like to turn it over to Patrick, who will go over the cannabis spending policy and then the recommended CAN grants. And then assuming your board agrees with those, they'll come up as we review the budget units as well. Go ahead, Patrick.
All right, good morning, board. I can start out with sort of the higher level review of the cannabis tax spending policy. If it would be helpful, I can put that up on the screen as a screen share, the spreadsheet we worked off of last time.
Yes, Patrick, if you would, I think that would be good. Jake, can you make it possible for Patrick to screen share?
Yeah, he already has that ability.
All right, so there's a few different columns here that may be helpful, and I think an update on the revenue that's come in so far would be a good starting point. At this time, the county has brought in $7.5 million approximately in cannabis tax revenue. This is the cultivation tax that has come in as of this point in time. There are still payments continue to be made. There's a few final cases that have to be sorted out, so that number may continue to go up. There is also the cannabis business tax that went into effect on January 1st. And there are not very many businesses in the county yet that is applicable to, but there will be 2 quarters of that tax collected in this year as well. But I can start out with this allocation. In column B, you'll note this is the allocation that was set last time by your board with each of these categories. The 15% to planning and code enforcement, water resources, 7.5% to law enforcement, 12.5% to economic development, housing, risk reduction, 2.5% to youth education, 10% to CAN grants, 30% to workforce retention and development, 7.5% to the Board of Supervisors discretionary fund, and finally the 15% to the stabilization fund. So what has been proposed this time is that the stabilization fund in this year, a recommendation from staff was that we could essentially satisfy that fund, get it up to the $2 million. That was the goal. And so then, just as an example, if everything were to remain proportional, this would become the new future allocation in column C. If no other changes were made, this is what it would essentially default to proportionally. Because once that stabilization fund hits 2 million, we would no longer be diverting funds into that unless your board recommended that at a future time if we were to increase that. So I did plug in over here in column D and column E, the 7.5 million that's come in this year so far, just to give you an idea of what this would mean in each of these categories. Obviously, these numbers are going to change, but this can just give you a reference for your consideration. And if there are any questions, I'm happy to address them.
Thank you very much, Mr. Sullivan. A quick question. Other than this being a review, this is also up for potential changes if we feel that percentages should be moved from one end to another, or a discussion of what stabilization fund means, and so on and so forth, correct?
Yes, that is correct.
Okay. Any comments from supervisors on this allocation review? Supervisor Cranberry?
Yes. When we get to the point where we can adjust these, or we can discuss adjusting these, I would like to see if we can discuss getting law enforcement closer to 12.5, if at all possible.
Okay. And I think right now is that conversation, so you're offering 12.5.
I would like somehow to take from the other allocations and apply it towards law enforcement. And the reason I say this, I don't know if I mentioned it last time during the discussion, but the reason I say this is on the North Shore, it just calls from every part of my district about law enforcement and needing their assistance. And law enforcement consistently needs bodies, needs resources, etc. And I know that in the BOS discretionary fund, I know that that's, I guess, amongst us as Board of Supervisors for whatever projects we desire. I know that for me, it's very imperative that law enforcement gets those resources. And from my belief is this: we have issues in this county with crime. The criminals are emboldened to keep doing what they're doing because there's not an amount of resources to conduct checks. There's not an amount of resources to be in to have the presence, and there's no support for. In some instances, code enforcement to be supported by law enforcement. And I know that there is a CAN grant coming out, and I'm very grateful for that, and I thought that was a very good plan coming forward. But I still feel that in the meantime, we need to be heavy-handed on this in order to ensure that we secure property safety, dumping, all of these type of things. If we don't have that, eventually the county will still be leaking funds, if that makes any sense, because we won't have property taxes paid. We won't have people investing in the community, and criminals will just keep on the rise and doing what they're doing. So that's how I feel. And I just wanted to mention that.
Thank you very much, Supervisor. Supervisor Simon?
I think, obviously, I think we had the discussion on law enforcement earlier. Ultimately, obviously, the protection of our community is always number one. But I did have a question on that discussion that we had last time, and this is for Patrick. Patrick, when we talked about this number for law enforcement, as far as our tax dollars we have now, there was a conversation we talked about there will be other funds that will be coming back from the state to law enforcement. Was that part of the conversation? Can you refresh my memory on that?
Yes, under Prop 64, the state is supposed to roll out various grants to local law enforcement. At this time, I'm only aware of one that they have done so far through the CHP, but more of those are supposed to come out. That there is money allocated, but the state, I think partially because of the pandemic response, has been slow about rolling those funds out there. So we know they should be coming, yet I can't really point to them existing right now.
Okay. And when we're talking about this, when we talk about workforce retention and development, that means all departments of the county, correct? The 30% that's down there? And that would include our law enforcement also?
Yes, my understanding on that was that all county departments would be involved. So law enforcement would be covered potentially within that as well as a subset.
Okay. I just wanted that clarification.
Thank you, Supervisor. Supervisor Scott?
I definitely agree. We need to be focusing on law enforcement and code enforcement. And Patrick, do you have an idea of the CAN grant, what percentage of this last funding that we're hoping to approve was in law enforcement and code enforcement? There was a pretty large chunk of that also. So we have to remember that there's money coming from that also.
Yeah, I think I can give you a quick idea here. About 247,000 of the CAN grants that we're going to review for recommendation shortly here are related to law enforcement. Code enforcement is getting additional funds under another outside grant, sort of like what I was talking about for law enforcement through Prop 64. They are getting 500,000 through a public health and safety grant that's beginning this year. So we're just starting to roll out the revenue from that.
I agree that we definitely need to be watching these. I would like to see maybe in 6 months come back and see what we've been able to improve in our community with the money we put out so far with our cannabis funds, and see really where we should be putting that more money, more energy into making our community a safer place.
Thank you, Supervisor. Anything else from supervisors on this topic? So I have a quick question for you. And I'm sorry, Supervisor Simon, did you have something else?
No.
Okay, I saw you unmute. Mr. Sullivan, 7.5 million, is that just what we've collected in this past fiscal year, or is that in total?
That's in the last fiscal year. So there is 744,000. That's a rollover. And that's part of what we're using to help pay for the CAN grants.
Okay, so then eventually, since the CAN grants are in the 630,000 range or whatever it was, then we'll have about 100,000 left over rolling over. So 7.6 is what we might be looking at. Okay. Just wanted to kind of figure out where we were specifically. So I have a lot to say about this. Stabilization fund. I like that it's $2 million, but what does it mean? And so to me, what I'm seeing, and I know it's not part of the conversation quite yet, but we've already discussed, I believe it was 2 new deputies for the sheriff at the cost of about $200,000, if I remember correctly, at our budget time that we discussed using some of that. So that's salaries. I want those deputies to be there for as long as we need to have them, and which should possibly be forever, right? We have some other CAN grants that are requesting for other salaries, and I'm concerned that this fund will become a salary fund. And then we're going to get squeezed when we can no longer collect this, because this is, to me, not a forever tax. I know I've mentioned this before. We have a democratically led Senate, House of Representatives, and administration. The potential of the federal government changing the Schedule I drug policy is very high. What does that look like as far as impacting the capability of cannabis to continue to pay $1 per square foot? Just to put it in numbers and comparisons, if you asked for a vineyard to pay $1 a square foot, there would be no vineyard. It's not possible. They don't make that much money off of grapes. And if eventually cannabis becomes a normal crop commodity, it has the potential to drop in value tremendously as well. So we need to look at this as a very one-time type of money, but I get it that there's some wiggle room to protect it and use it for certain salaries. So I think that we need to look at stabilization funds as for 3 years, minimum of 3 years, I would say 5 years, but minimum of 3 years, that will help to pay for the salaries of those that are being paid from the cannabis tax. And so you divide 2 million by 3, you get $633,000 a year that can be dedicated specifically to salaries, where now you know you can make those things be long-term. Because yes, we use extra help, but mainly we want people to be salaried. We want people to dig their roots here, stay here, serve their communities. And it makes a difference when you have a job that's kind of like on a grant-to-grant basis. That makes it really difficult to promise somebody that you can stay here for a long-term period. So I would like to see the stabilization fund. First, I'd like to see us limit the amount of money that cannabis taxes can be used for salaries. And then I would like to dedicate the stabilization fund to help with ensuring that we can continue to pay that for a minimum of 3 years. If it's 5 years, it would limit it to $400,000 per year used for salaries. So that's something that I would like to see. I worry about the workforce retention and development. And just to be very frank and honest, I see that as salary increases to help with what we've talked about has been phase 1 of our class and comp. I don't want to see 30% on that. If there's a plan for stipends, or if there's a plan for hiring incentives to get people to fill in those positions, then I can see that as being used for workforce retention and development. But used for salaries, that is a large amount of money for salaries. I know we've talked about law enforcement, and absolutely, but here's the problem is we can throw as much money as we want at it. Are we actually hiring? So we need to look at that process first. What is the incentive to fill those positions? Because we already gave $200,000 with more to ask for in case it's filled, but it's not filled yet. And so we need to not just put money because it feels good. We need to put money where it's going to actually function in providing something back in return. So let's talk about what is the incentives. Let's talk about what is the long-term plan versus just having money in a budget item that feels good. I think our number one place, I agree with code enforcement. There's 2 places that I would like to see money be dedicated to. One is we know that we need to do some great strides in changing our planning department. And whatever we need to do, again, with hiring incentives, whatever we need to do with retention, whatever we need to do with hiring contractors to come in and do some of the work, if we solve the problem in planning, and I know that there's a lot happening to try and solve planning, but if we solve the situation in planning, that will create more money for us. So rather than just spending money and seeing it go away, I think we need to spend money to make money, because this is one-time money. We need to reinvest this in a way that if we can get all our applications done in 6 months to a year in our planning department, we're going to benefit from that in property taxes. We're going to benefit from that in sales tax and even TOT and so on and so forth. And I think that is our number one source of income. And that should be our number one focus for where some of this money will go. Not salaries, again, we need to limit that, but contractors, I'm okay with. That's on a year-to-year basis. As far as code enforcement, I spoke with Director De Leon. He's still trying to fill in some of our code enforcement positions. He's hopeful that that will get done. I'd like to do the same scenario as we did for our sheriff, where we said, look, once you've done hiring with the money you have in your budget, you have $200,000 available to you to hire more. I would like to do something similar where it can either be used to hire more code enforcement positions or have abatement money so we can actually just finish the job rather than paper push asking someone else to do it who can ignore us entirely if they want to. We need to make sure that we can do the final work, because unfortunately people play the bluff until they see us and appeal it and we say, sorry, you actually need to clean up your property. So I would love to see money put in abatement. I would love to see an incentive package being spoken of difficult positions that have not been filled for a long time that we can't seem to fill. What does that incentive package looks like? And maybe even have a cannabis stipend where those positions are absolutely necessary for us to really turn the dial in our communities. What can we do to intensify without touching their salary, but as a stipend to make them want to stay and continue to serve their communities? So that's what I would like to see. The way that I see it as is, I'm concerned that we're not going to see a large benefit. We need to have almost like a goal. A goal would be fire suppression and code enforcement abatement. And also, on the other side, we just spoke about behavioral health. Same thing. We know as we continue, because we're not done, as we continue with COVID-19, we need to figure out how to fill all those positions that Director Metcalf is struggling to fill in. What can we do to, again, incentivize to fill those positions and retain those positions? Because we could talk about all the stuff we want to do, but if we can't fill those positions, we're never going to get it done. So those are some of my priorities, is what can we do with behavioral health, code enforcement, and planning department. Supervisor Pyska?
I want to respond to some of your comments. I agree with most of them. I think looking at this as one-time revenue to figure out, did I freeze?
Your face did, but you could still talk.
Okay. You know, how we can treat this special one-time revenue because we don't know, you know, what the future looks like, to get our house in order and raise revenue in the future. And so investing in our revenue generating departments like CDD to set them up so that they can, so that the cannabis program can be successful, so that the CDD, all of community development can be successful. So if we have, I really look at that as an investment. And then we can get to the place where we can really encourage more housing to be built, which again will get houses on the tax rolls, which will build our revenue over time. So I agree with that, and you know, after doing all these orientations and talking to almost all of the department heads about vacancies, some of these vacancies have been open a long, long time, and if we can use this, some of the workforce retention and development to incentivize hires, I'm on board for that. Also looking at how we can make our benefit packages maybe more attractive. And I don't know how long, this is a lot of money here, $2.2 million. I don't know how long that would last with our staff, but we really need to take the next step on building out those packages so that we can attract people to come and stay here and invest with us. Obviously, I really want some funds in abatement for fire mitigation and really building out our hazardous vegetation abatement ordinance that was created a couple of years ago, but there's not really a program around that. And we need to have some funds that we can use for abatement if we want to get serious about that program, and we're going to need more code enforcement officers with that as well. With the risk reduction section, you know, I talked to you last week about a co-ed director. for this fledgling program that we have. We need to have a paid director, and it needs to be a permanent position, and we need to figure out how to fund that going forward. There are a few opportunities that I'm working on. I would like to suggest that we fund this position for 1 year. We look at other opportunities to put that into permanent funding, because we're going to continue to have our disasters, and some will be small and some will be large, and that's just our reality of where our climate is right now. And this is how we can support our community at all levels. So I'd really like to see that money get allocated right away so that we can have a co-ed director up and running before fire season starts, and we have a solid plan to get us through this next year. So those are my recommendations. I agree with most of yours, Supervisor Sabatier, and I just want to kind of hear what everybody else has to say.
Supervisor Crandall?
Yes, no, thank you everyone for accentuating what's important. Because it's all important, it's just a limit of funds is really where it's at. And I definitely do not want to throw money at law enforcement because I like it or anything like that. My main comment is the people in my district aren't liking what they're dealing with when it comes to criminals. One of the things I've noticed in the past month is arrests made for health and safety codes that are taking place, but those are in the cities. Each time I see those, they're from the cities, and I'd be grateful if I had a city to have that arrest take place. And then there's the problem too of holding them. So I know that there's a number of issues that are coming forward in that. However, I know that these are one-time funds. I know that we're not looking at them as a long-term, but in any situation when you want to strengthen or bolster or even solve a problem, you have to also do things on the other side. So I'm also meeting with these community members and trying to educate them on different things we can do on that end. I just feel like while we have the chance and the time, the funding, we should front load a little more on law enforcement so that they can do, or at least have the opportunity to do what they need to. I agree with all of you. I respect all of you, and I just wanted to accentuate that because it's not just about the dilapidated homes and whatnot. It's also the cannabis grows, and that's slowly becoming an issue, just like you said, Supervisor Sabatier, where if this becomes legal, it takes away this whole situation. But also, if these illegal grows keep happening, people are going to say, why am I doing it illegally, especially in Spring Valley? Because that's a big problem area for illegal grows. And I know the community development does their best. They were out there last year and they did at least 43, which is a big number. But then at the same time, there's still others that are happening. And so, we want to also look at things like, cameras and other equipment, not just salaries. And so, I know that looks more like some of the things that are coming in the CAN grants, and hopefully that those that come forward are appealable. I just want to accentuate that. And however this happens, I respect all of you. I just need to plead my case for my constituency. So.
Appreciate it, Supervisor. Supervisor Simon?
Yeah, I think, obviously, I think, all the points are valid. Everyone has our community issues that we're currently dealing with. Law enforcement always is a conversation we're working on. We've just implemented, obviously, I can't remember the exact date that we voted on this to implement. We haven't even gone 6 months to see what the implementation in the process is, allowing it to move into, effectiveness instead of just setting through. We're going to be approving some CANA grants today. We said, hey, get those funds out there, have another round. I want to thank Supervisor Scott and Crandall for bringing this back to us to be able to do that. So that's an initial step forward. And I think, definitely, I think every time we talk about it, there's an opportunity to get everything out there to talk, but it really hasn't had a chance to be implemented in the structure that we've just passed it. I think mid-year budget time would give us a little more time to make sure that the funds that we have allocated are being spent in the right direction. The new CANA grants that we have and said, hey, I think Supervisor Sabatier said, hey, we need to get those out. They are here today for our approval, and that's a step in that direction. So, my thoughts are at this point, I think everything that's said today is a valid point, but I think we need to see what the implementation is and what we're going to get as a result on the decisions we've currently made. Because we just keep changing them every time we come back, every three times a year. you know, we're going to be going all over the place. So those are my thoughts. You know, I think it'd be more appropriate to make some changes at the mid-year budget, but ultimately it's up to the board, and respect everything that was said today. But I think we should kind of stay the course right now, see the implementation of some of these new CAN grants and the funds, and as we've set them right now, and what effect they have over the next few months.
And just for a clarification, Supervisor Simon, you meant the normal budget rather than mid-year budget?
Yes.
Okay, thank you. Supervisor Scott?
That is actually one thing that we spoke about in our committee is having these groups come back and have a presentation to the board of how they've spent their funding, how it's working, how their program's working, and what they would do differently. So we would have a really good idea of how our money's being spent and what programs are working and not working, so we can come back and try to maybe change the numbers around or do things differently. So that is actually part of our plan.
Supervisor Pyska, did you have something more?
I was just thinking about Supervisor Crandall's request, and I'm wondering if it's better, rather than adjust the percentage, to maybe come up with a strategy that specifically targets the crime in the areas that he's dealing with, and then figure out the cost of that.
Okay, thank you for that. Any further comments from supervisors? So I will say that I'm not trying to change the whole thing, but I do worry that we end up with so much on our salaries that we can't change in the near future. So I would still like to see a limitation on the amount of money that's going to be used for salaries, where right now, it could be the entirety of it that could, if we agree to it. And at that point, I think we would be stuck with what we have, and there would be no flexibility. And I still think that we need to look at limitation on the amount that is going to be used for salaries. I also think that, I know it says workforce retention and development, but I think that is absolutely a priority, which can help with anything else that we throw at salary. Because again, we've already provided some to salary, but it's not being used because it can't be used. So if we can figure out a way to fill in those long-term positions that are not long-term positions, those positions for a long time that have been empty and vacant, I think that would make a huge change in what's possible. So those are really my two asks. The rest, it can be seen as to how each department goes about to access those funds and what it will be used for. And either way, those will be coming to us for final approval. And I'm kind of looking at Mr. Sullivan and Ms. Hutchinson for whether or not that would be the case, but I would suspect that that would be the case, not just this allocation and then go. It would be the allocation, and then they would submit their plans for how to use those allocations. Ms. Hutchinson?
You're talking about beyond the CAN grant proposals today?
Yes.
Yes.
Yeah.
You are, yes, that is accurate.
Okay. I appreciate that. Supervisor Crandall.
Yes, and you know, I thank you, Supervisor Pyska, for mentioning some different you know, initiatives to combat the situation we have. We've asked that before, and with the sheriff, his comment is commonly he needs bodies, he needs people. One of the biggest deterrents to some of this criminal activity is actual patrolling. But you know, and I understand it's the community that I'm dealing with, the communities, because there's more, they're willing to do stuff as well. And so that's where I'm coming in and meeting with them and trying to have these other things that we could do to combat that. But at the same time, with this potential one-time funding, you know, or, you know, this period of one-time funding for however long this lasts, I would like to put the emphasis into law enforcement. And the other thing is I know that we came up with this, you know, last year around October, November timeframe, and I'm remiss because I didn't speak more candidly about it back then. I just kind of let it be and thought maybe this would work out. And so I apologize that I didn't emphasize this. I felt the same way then, and I think I've talked about it before. I've kind of went back and forth, but it's a very important issue in the community of the North Shore, and so I just wanted to respond in those ways.
Thank you. If no further comments, let's go ahead and open it up to the public, specifically on the cannabis allocation that you see before you. Jake,
Mr.
please.
Chair, do you want us to continue the share screen then?
Yes, just for this part, and then we'll move on to, I believe the next was probably the CAN grants themselves. Yeah.
All right, I've sent a unmute request out to the Zoom room floor. If you would like to make a comment, please unmute and state your first and last name.
I would like to say something. My name is Jonathan Cronin. Would it be possible if I spoke right now?
Go for it, Jonathan.
Well, thank you for allowing me to speak. The residents of Nice and Lucerne would like to see the Sheriff's Department receive some major funding to maintain and expand their services. We have elderly in this neighborhood that are even scared to leave their house. So it's easy to say, don't fund the police department when you're feeling safe in your own house. But we have people that, you know, they can't even walk their dog because they're worried to walk in certain parts of this neighborhood. And by funding the, by not funding the sheriff's office, we're affecting everybody's livelihood. So if you go down to like the boat launches, you know, you're seeing a lot of homeless hanging out there. How are we going to attract tourists to this area if we don't clean up the blight? And most of the blight is coming from these druggies around the county. So these meth houses, you know, they're constantly having traffic. There's stolen cars all the time, stripped out cars. And we need to do more to clean up this neighborhood. And it really starts with, you know, funding the sheriff's office. So I'd like to see some of this money go towards camera, towards security, more equipment that the sheriff's office could use. So thank you for your time, but I really think we need to invest in our sheriff's department.
Thank you, Jonathan. Any other comment from the public? Susan.
Hi, I'm doing my video. Oh, I just wanted to comment. I know that there is an increase of these low-level quality of life crimes, and I don't have a solution necessarily. I think increased patrol by law enforcement would be a great idea. I just want to point out that you can increase patrol, but if you don't have the prosecutors to prosecute it, then it doesn't result in anything. But unfortunately, because of the pandemic, we are still under a zero bail policy from the court. So a lot of these crimes or offenses are not arrestable. What's happening is that people are being cited out if they're even being contacted by law enforcement. And in most cases, they cannot be arrested because of the current emergency bail in place. In addition, misdemeanor crimes are being charged, but we're not being able to go to trial on them. We are trying to get plea bargains or pleas out of those cases, but misdemeanor trials, which most of these cases fall into that category, are actually being set by the court into January 2022. So this is a statewide problem that we're not just Lake County, and I am all for whatever solutions that we can come up with to address it. Thank you.
Susan. Next was Jennifer, and I can't see your last name. Den something?
It's Denham.
Denham. Go for it.
Can you hear me?
Yep, go ahead and give us your full name, please.
Yes, my name is Jennifer Denham, and I live on Hudson Avenue, and I agree with additional code enforcement and law enforcement here. We have 2 residents here with multiple people in them, and they're all converging together. My personal experience is I've had things stolen from my house, my plants ripped out of my garden, my motion lights from my security taken, and they've even attempted to steal my truck by popping the lock out. And this is all while I've been home. So it is very scary for me here. I've been here about 2 years, and there's a few houses on this street in this area that are ridiculous. Multiple cars, they blocked, the roads. I've had ambulances here for my son who has had seizures. That's all I have to say, I guess. Thank you.
Thank you, Jennifer. Next, I didn't know which one was next, but let's go with Cindy Leonard.
Thank you. This is Cindy Leonard from the Cobb Area Council, and I'm part of the steering committee for the Lake County COAD, and I just wanted to voice my support for asking for help to hire a COAD director. Like Supervisor Paiska said, there is a few opportunities that are potentially going to be coming to help the COADs in the future, but we really need help right now. We are lucky enough to have been able to put together a website for our COAD, and we are participating with the Northern California Regional COAD VOAD Coalition. That meeting actually starts at 11:30. And so we're still building the COAD, but what we really need is a director. The director would, when funded, would be able to help build the collaboration amongst all of the voluntary organizations and agencies that work for recovery. And this also has a side benefit of the communication and collaboration helps get us out of the silos that seem to be an ongoing issue. And it would really be essential to being able to reach the most vulnerable populations, which seems to be one of the issues that we're having when we deal with disasters in the short term and in the long term. So I really want to emphasize the importance, especially right now when we have, we've got the ball rolling, we've got some really great momentum. We're really forming some alliances with the Napa Valley COAD and the Sonoma County COAD. Both of them have directors that are strengthening their organizations, and we would love to have some help, at least to bridge until the state, through the LISOS program or through other potential things we're working on, just to kind of get us to that next stage. Thank you very much.
Thank you very much. Next we have, sorry if I mispronounced your name, Alicia Russell.
It's Alicia Russell. Thank you. And I want to say that I find value in everything that has been listed for allocation, and I don't disagree with anything that's been stated so far in this meeting. What I just would like to point out, though, is that the backlog in community development, specifically in the planning department, is standing in your way of getting even more of this revenue to the table. Whether this is a temporary thing based upon the federal legalization or not, the potential is there to have so much more of this money to be going around if that backlog could get cleared out. I think support really needs to be thrown into the planning department to help them get current. The planners that are there are overloaded. They have so many use permits that are in the queue waiting to be heard that they can't get to because they don't have the manpower. If you supported that, if you brought in more planners, incentivized it, you could clear that backlog and you'd have so much more money potentially that you could be putting into these other issues as well. Everything could get supported if we could just get that cleared through.
Thank you, Alicia. Any further public comment on this specific item? Okay, hearing none, let's bring it back to the board. I know that there's been some conversation. I don't know that we have any specific consensus on whether we go as is or if there are some changes. So I was just going to bring up to see if there's a consensus for certain changes. I know that Supervisor Crandall asked to change the law enforcement to 12.5. Is there a consensus to make that change? Okay. I would say that I'd love to see that change with the concept of we need to spend the money that's already there. And at this moment, none of that money has been spent. I believe actually there might be a request for $200,000, but that nothing else has been requested thus far. How about for limitation on salaries to be used by this money? So I would like to see a limitation of the amount of cannabis taxes that's used for salaries. And I see no other hand up or no other head shake, so let's move on.
What do you suggest?
I suggest limiting it to a maximum of $2 million and having I would like whatever suggestion we offer to have that kicked back to the committee who is already working on this, to have them come back with something more specific. Because I don't think we're going to finalize anything today. And so if there was a request to, if there was a consensus to change law enforcement, then that would be kicked back and then they could come back, that team can work on it and come back with a new offer, a new ask. If there was a request or a consensus to limit the use of funds for salaries, then that would come back. But I don't want to give specifics because I want it to be a conversation that could be had in a committee, which is more candid, more spitballing of bad ideas and good ideas, where eventually that can come back to us with their consensus. But that's just, again, just offering the suggestions that have been brought up. And I see that Supervisor Scott has her hand up.
I do agree we need to be looking at salaries and having some sort of cap or limit so we don't get ourselves into a position where we lose this funding and we'll lose those positions. So I do think that that should be a discussion that this committee has. Okay.
Is there anyone else that agrees with that? Okay, so I see 3 nodding on that. How about
Supervisor? Yes. You know, like I said earlier today, you know, I think when we're talking about it, you know, I really appreciate the work that's been done by the committee. And as you said, you know, I think everything we've talked about today, I would appreciate the committee going back and considering those potential changes and then bringing it back to us. You know, like you said, I think they can really dive into the discussion and get specific on things and come back with a proposal. As I said today, and I'm not against any changes happening. I'd just like to see some more time where we could spend the funds that we've currently allocated. And just one comment too off of public comment. I just want to make it very clear. My comments about law enforcement, and you know, I heard one of the public comments say, you know, not funding the police. That was never ever my intention when I voted on this. There's $661,000 at this point allocated over there, or 562,000. Sorry, 500. Always support law enforcement and helping us move forward in our communities. So I just wanted to address that because at no point did I hear any board member say not funding law enforcement. It was just an increase of the funding that we currently improved. So I just wanted to make that statement.
Yeah, thank you.
And I just want to add to that, Supervisor Simon, you know, there has been a significant allocation here with law enforcement and in other places. And we have heard that there's a great need on the North Shore in the communities, but I'd kind of like to see, you know, what needs beyond what's already been allocated in a strategy put forward. So, that's what I would like to see.
Okay. And Supervisor Simon, just to kind of clarify, I'm not looking to pause what we're doing. I'm looking to provide guidance to the committee for discussion so that they don't come back with something that we don't support. And since we already brought up some of these items, let's give them a little bit more specific of a direction of things to review so they can come back when they feel that they have something more concrete to bring to us, but not to pause the allocations that we have in front of us, but for further clarification of what those allocations look like for the future. Okay. The other part also, I brought up incentive program and retention program, wondering if there's consensus that we can look at what that might look like coming from the cannabis taxes, if that's appropriate for that committee to review.
I believe it is.
Yes.
Okay, I'm seeing 3 nods. And the last one, which is very vague and doesn't really provide us any guidance, is BOS discretionary fund. Is that one big project that we all agree on? Is that split evenly by 5? I think that I need that committee to come back with a little bit more guidance on what exactly is discretionary fund, and how does that function?
Yeah, I would agreement on that one, because what I've heard some of the district-specific situations that we have going on, I think there are opportunities. I heard at least from a couple different members, and I know we all have, things that we would like to address in the area that's going to benefit the entire county, but are specifically to our district. So, yeah, some more clarification on that would be good, because it sounds like there are some ideas from individual board members that this could be a step forward in addressing those issues that were brought up today. So, yeah, some more clarification on that would be beneficial for each one of us.
Okay. And I also, just putting it out there because I heard it from at least one supervisor, and just real quick before I skip, I know I heard from Supervisor Simon, is that, do we have consensus on reviewing the BOS discretion fund?
Yes.
Okay. I see other nods, so okay. And then the COAD director was brought up by Supervisor Pyska, as well as a member of the public. Just wanted to check in if that's something that we would like this board to look at, if it fits within one of those categories, or if it's needed as a separate item, or if that belongs to the BOS discretionary fund, how it is that we want to look at that. Is that something that we have consensus to kind of review and see where it fits in, or how that might function?
I think that needs to come back for a larger discussion. There might be other funds somewhere else that we could be, looking at that. I definitely agree that's something that we need to look at, but I think it needs to be a larger discussion.
I agree with that.
Yep. I suggested that it come out of the economic development, housing, and risk reduction. And it's just my suggestion that it's sort of a bridge allocation, because it is going to take several months to get funding from other sources.
Okay, and what we can do is direct staff to maybe bring that back as a larger discussion, which we can discuss where that funding comes from at a later agenda item, if that's agreeable for everybody. Okay, so.
Yeah. Supervisor, I just want to mention something too. I know that the Risk Reduction Authority that we put together as the JPA, we're looking for the same thing for that organization as an executive director or somebody that can help us keep moving the Risk Reduction Authority that's been moving forward. I know we're going to have some stuff, so just want to make sure, that, obviously it's something we're all very passionate about, but being the chair of that, I know that's the next step that we need to. So just in those general discussions, looking at those opportunities to really help us, move forward with our risk reduction, especially for fire right now. That's what we're dealing with, but there's plenty of other issues we need to address.
Okay, and I know you guys have a retreat coming up, and so maybe out of that can come a conversation to the Board of Supervisors. Ms. Hutchinson, do you need me to repeat any of those items to kick back to the committee to have further discussions about?
No, I was taking notes and I have it all. Thank you.
Okay. I think we have completely slaughtered this topic. If there's any further comments, let's have it, or else we're going to move on to the CAN grants, or the latest second round of CAN grants. Okay, Mr. Sullivan, I take it that's still you.
All right, I will do a screen share on the CAN grants at this time so I can put them up for everybody.
And just to explain to everybody, this is a large conversation because this is a large pot of new money that we have not had in the past. And it's an important conversation to have to ensure that we are putting it in the right places. So just in case you weren't aware of why we're having a very long conversation here. And I appreciate Supervisor's comments.
And just a moment, I'm having some difficulty getting that one to load here, and I'm not sure why. Sure, actually, Stephen might be putting this up for me here because for some reason this one is not wanting to load.
Okay. Looks like Stephen's hard at work to try to get that done.
Oh, well, you know what? It just went through. Sorry about that.
Okay.
All right, so this is the second round of the CAN grant allocations. These are the proposals that were considered by the committee and recommended for approval. I can run through them quickly here. The first one is from environmental health. This is a focus on illegal cannabis cultivation and hazardous waste enforcement. There's going to be $51,153 allocated here is the recommendation. And this covers the cost of training, equipment, and investigation focused on this. The next one is integrated waste management for a community cleanup program. This is going to provide for a community-based group equipment trailer and assist with landfill fees. I just want to highlight these were much larger proposals, so I'm giving a very condensed version. All applicants submitted very detailed proposals that were reviewed by the committee. $43,091 is recommended there. Next up is public services and facilities maintenance. This is for improvements on the second floor of the courthouse. And this is operational improvements to the physical office spaces there. This is $34,000. And I would also highlight, I'm sorry, I should have done this at the beginning, these different columns. We have the total amount that's recommended for allocation, but we also broke down a difference between one-time costs and what annual recurring costs might be. And that sort of falls back to the discussion that was had earlier. I'm starting to keep track of what expenses would be ongoing and what would be one time as we're reviewing these revenues. Public services, parks and recreation. It's a recommendation of $51,000 to be allocated for a Lake County Recreation Center feasibility study. That would cover the cost of the feasibility study for development of a county recreation center. This furthers the work of an existing task force and funds needed stemming from the next steps on a 2020 RFP. IT, information technology had a request in. This would be $18,500 for the information technology disaster recovery enhancement phase 1 project. And this is expanded equipment and cloud-based storage for backup and recovery. Let's see, the library submitted a request. This is increased access for Lake County Library for Youth. This is for increased staff hours, children's programming, and materials. This is an allocation of $166,800. And this is, these later proposals, it might be important to note the breakdown of what is one-time cost versus what's an annual recurring cost. The vast majority of the library's project is a recurring cost because most of that expense is staff. There would be increased staff associated with this expanded access. So $26,200 is related to the programming and materials. $140,600 would be the estimated recurring staff cost each year. The Sheriff's Office submitted a two-part proposal here. First is for a combined law enforcement, code enforcement partnership project. The recommended allocations for $166,323. This provides for a dedicated sergeant to focus on co-occurring law and code enforcement issues. And the $200,000 allocation referenced by your board earlier, one of the positions for the Sheriff's Office that would be funded by that would also be associated with this project. So my understanding is that there would be 2 deputies involved in this project focusing on code enforcement related matters. This one, just noting, similar to the library project, the majority of expense comes from staff cost. So there's $7,500 in one-time expense, $158,823 in recurring costs, the bulk of which is staff. The second half of the sheriff's proposal is for automated license plate readers. This is a total of $81,500 as a recommended allocation. It provides for the installation and lease of these readers for use in general patrol and targeted investigations. There's a one-time cost of $16,500 that goes towards installation. Then there is $65,000 ongoing for the lease costs associated with the cameras. The sheriff's office would not be owning the cameras. They would be leasing them so that it would be easier to upgrade in the future, was my understanding, instead of paying out that cost now. So these columns at the bottom here have the breakdown of the total recommended allocation in D, the total one-time costs in E, and the annual recurring costs in F. So at this time, I'm happy to answer any questions about this. There were, the only project in here that's not specifically addressed that did submit a proposal was special districts. Their proposal was very large in cost, and right now they are looking into other grant opportunities. We were the first grant opportunity they had looked at. So there would be the potential in the future to still possibly do that project, but first other funding opportunities are going to be examined for those possibilities.
Thank you very much, Mr. Sullivan. Any comments or questions from the board? Okay, seeing none. I want to discuss a few of these items. As you can see on the bottom, it's more than 50%. That would be pretty much a salary almost. If you take out the 65,000, it's about 50%. That would be a reoccurring salary. And so that was kind of my point I was making earlier, that's why it needs to be reviewed, because that's a large amount. I think that when it comes to our sheriff's request, for the fact that it's not many positions, that one needs to stay. But I'm thinking that right now, if I'm correct, the positions for the library is looking for, is it 8 or 10 positions? I forget what the position allocation was for that.
I would have to go in their proposal to figure it out, or I'm not sure if
I have it right here.
5.6 is actually
yeah, it went from 5.1 to 10.75.
5.65, sorry.
Right, thank you so much. And I was thinking that's a large amount to hire in comparison to all the staff that library has at this moment. I would like to see us maybe cutting that in half and having Mr. Veach come back to us if he's able to fill those positions. But I want, again, I'm trying to decrease that ratio of what's being spent and what's an annual salary, rather than dedicating so much of that to it. I'd rather see where we are, where we stand, and how it's helping at this moment in time. Also, information technology and the courthouse second floor counter renovations. I know that we spoke with Ms. Grant, and we can use this grant funding on anything that we want. But the rest somewhat fit within law enforcement, environmental protection, water quality, and education. You know, we can bend and move in so many different ways, but those two, in my opinion, don't quite fit there. And I'd love to see, and I'm sorry, I missed one also, the feasibility study as well. Wondering if we can look for other ways to fund those. For instance, the feasibility study, if it's a recreation center, that would create jobs. And so if you go to the, I forget what the, is it the Economic Development Administration, the EDA, from the federal government, they offer feasibility grants if it's going to create jobs. Have we tried that? I'm not sure. And just looking for, trying to keep it as close as possible to what the voters voted for, even though we do have the capability to use it for what we want. So those are the ones that I question if we can change, as well as the number of new employees for the library.
So, Mr. Chair, if I could just make one comment regarding the points you just made, and that would be to the renovations for the second floor. The reason those renovations are proposed is because of the cash payments and the minimal security on that floor. And so that came out of the work of a committee that began meeting after final budget hearings with your board when that problem was identified. And so staff feels strongly that that should remain because it is brought about because of cannabis and the fact that cash payments are often made.
Okay. Appreciate the comment and the clarification. Any further comments from the board on this? Supervisor Scott?
I'm involved in the feasibility study program, and that's actually something that both the cities and the counties are working on. We're actually, right now, we need the funding to be able to match what the cities have put up to be able to continue this work. I do see that it falls under the cannabis because it's trying to find something better for our youth. And I know that youth was a big part of our cannabis and keeping our youth out of trouble and finding something else for them to do. And I really think this would be an amazing program. We're not just looking at maybe one facility, but one on each side of the lake to be able to encompass all of our youth here in Lake County.
Thank you. Any further comments?
My question about the library staff is that for next fiscal year? So we're thinking that COVID restrictions won't be so intense, or what are the staffing? How is hiring all this extra staff if people can't function, can't use the libraries right now? What's the reality of that for this year and next year?
And it looks like we have Director Beach with us, and maybe he'd like to respond to that.
Hi, this is Christopher Veach, County Librarian. Can you hear me?
Yes.
So the request is for changes to 8 positions. It would be 5 new positions at the library assistant level, and then increasing hours on 3 current positions to full-time from part-time. The goal would be to actually increase the number of hours that the library is open to the public, which even during COVID times would increase access to our curbside pickup service and contactless service, especially at the Middletown Library branch, which has reduced hours compared to our 2 larger branches in Clear Lake and Lakeport. It's also increasing the number of materials, which, in order to increase services at the library, we have to have increased staff. That's just the way it works, because there has to be staff to deliver those services, and the library has a very slim staff right now. I'm happy to answer any other questions if that didn't suffice.
That's great, thank you.
Thank you so much. Supervisor Simon?
Yeah, I was on mute, I apologize. I just want to thank the committee for bringing these proposals. I know at the last time we reviewed this, we said, hey, we want to get the extra funds that we had out there. I think it was over $700,000 to come back with some proposals as we move forward. I clearly hear your concerns about long-term staff that will be coming in, but on the proposals that I've seen today that were presented, I'm in support of all of them moving forward at this point, and just wanted to make that clear right now.
Thank you, Supervisor. Supervisor Scott?
Yeah, I just wanted to add with the library, I'm glad that our Director Beach was here to let us know that we are trying to get as much services out during this COVID time. And with the schools being closed, I think we need to be looking at our libraries to offer books and services to our youth. So I think that's incredibly important to keep that there.
Okay. Any further comments before we open it up for the public? Oh, I see Mr. Carter has his hand up.
I wanted to make one clarification. Supervisor Pyska asked about when this could go into effect. This would be part of the position allocation for mid-year, so that means literally once, if it is approved, he can start tomorrow. And yes, that would potentially go into next fiscal year as well as an ongoing expense.
Thank you for the clarification. Let's go ahead and open it up to the public. Jake, if you can please send out a unmute to the Zoom room.
All right, I've sent that request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
I see Alicia Russell has her hand up.
I do, thank you. I would just like to state that as a person who has accompanied a large cash payment into the second floor at the Treasury, it is unnerving to exchange that amount of cash in the current setup that they have. There's always that knowledge that there's a second floor exit, that there's a minimum level of security in that area. It's very uncomfortable. So whatever could be done to improve that, both for the person that's bringing in the cash payments as well as those that are receiving it, I would really, really urge the board to support that.
Okay, thank you so much. Any further public comment? Okay, we're done with public comment. And let's bring it back to the board for either further deliberation or action.
So, Mr. Chair, in terms of the action, it's intended that we would review each budget unit where these funds are intended to land, and then your action would be at the end. Right. But of course, you can give us direction not to do that if you want us to handle it a different way.
No, I apologize. We have a resolution to get to, and so we're working our way towards that. I believe that if there's no further comments, we can go ahead and close that down and move on to the next part of our mid-year budget review.
Good morning, board. Stephen Carter, admin office. I should have said that actually the first time I spoke. So now that we've gone over the overview and the cannabis program grant as well as the plan, I'd like to go over a few of the funding sources for the general fund. So whether it's how it's anticipated to come in versus the actual so far, and whether it is coming in satisfactory or not. So the revenue trends, the three main ones I would like to talk about is transient occupancy tax, property tax, and sales tax. So I'll start with TOT. We budgeted $520,000 to be received this fiscal year. It was not increased to the last 2 years actuals that were about $630,000 simply because of the pandemic environment. What we have actually received so far through February is $424,170, which is 81.6% of the 520, but it is far below, about $90,000 below where we were this time last year and the year before. Now, with that said, if you go one more year back, this is already over the overall amount. So we're still higher if you take a 3-year average, but TOT is not coming in as well as we would hope, but it's within what we budgeted. So that's an important statement. And then moving on to property tax, that's a whole different story. We have actually received so far $9,598,594. It's quite a mouthful, which is about 58.7% of what we anticipated, which was just over 16.3 million. At this time of year through January receipts, the past 3 years, we've received between 54 and 56% of what we had of the total received that year. So the fact that we have received 58.7 already on the 16,300,000 that is budgeted, the year-end estimate is actually going to be slightly higher. So I would project that it's going to come in higher than budget, which is very good. And then sales tax, the anticipated budget was only $2,625,000, and we received last year 3.2 million. The reason why we decreased was because the potential loss of sales tax due to COVID environment. Well, in our county, in the unincorporated area for the Bradley Burns 1%, it is not coming in lower than last year at all. So what we've actually received so far is $2,300,372, which is already 87.6% of what we budgeted. But the important part is it's even above track. So last year when we received 3.2 million, that was actually one of the highest years we've received in the last 10 years. We are on track to actually, if you look at the last 5 months of the year and then average that into this year, we're on track to receive just over 3.4, in between 3.4 and 3.6 million. So that's actually a decent, very, very good increase potential in sales tax. So that is actually against the grain compared to a lot of places related to sales tax in the COVID environment. But I wanted you to be aware that that's actually coming in extremely well. And then I'll go into what I refer to as the weeds of the mid-year budget. So that's more transactional data, unless people have questions about the overall revenue.
No, just like the good news.
It's very good news.
Coming.
It's nice to sometimes be able to give good news instead of always the doom and gloom. Honestly, it really is.
I will say that we are a lucky county. That is not every county at all that can speak of that. I know El Dorado is hurting because of Lake Tahoe having a huge drop in tourism. And even our neighbor Sonoma County is hurting as well. And so we find ourselves in a very positive situation given such a negative atmosphere that we're in.
We are part of the very few that have this version of sales tax. So the first item I'd like to talk about, and I'm going to go through the reserves, what I consider to be a highlight. Do you want me to put anything up? I see Bruno's looking a little.
I'm looking at my other computer, but I think it would be nice for the public to see. If you can go ahead and put it up.
I'll put up the budget narrative highlights, which I've highlighted. So let me unhighlight real quick. So what I have put on the screen is the mid-year budget highlights, which is just a brief overview of some of the adjustments that are being requested in mid-year. It is by no means.
Can you make it a little bigger?
Yeah, hang on.
That's better. Perfect.
Okay. That's really big on my screen, so I have to go backwards. So because I came into the beginning of a sheet, let me go back up to the top with reserves. So the first reserve that is being requested to be adjusted is the budget unit 1072, which is cannabis program. And we're requesting that it increase by $600,001. The reason for that is the original budget for revenue, we only budgeted 5 million. Well, we just heard 7.5 is current. So I increased the revenue by 2.3 million to make it 7.3, because at the time it was only about 7.3, 3.5. So the part that is not in appropriations, which I am requesting to increase appropriations by 1.5 million, which is for expenses that would be related to the board approved policy and for spending the cannabis tax. And then also 150,000 grant that we received for the cannabis study. We have a contract with Humboldt State for that study. So that would be why what's left over after the 2.3 million increase is 600,000 to go into reserves, so that we don't leave a large amount just in appropriations that will not likely be used. Next up would be budget unit 1920, which is disaster response and recovery. So that budget unit is requesting to increase reserves by $2 million even, and that's for potential audit exceptions from our FEMA claims for our 12 unaudited disasters. This money is coming from fund balance available, which means carryover funds. And those funds became available because there was a PG&E settlement that was originally deposited in 2021. Well, at the time, when we have the budget, we assumed it came in July. Well, we had to accrue that money back to previous year to match when the actual settlement happened, which made it a fund balance carryover instead of new revenue in this fiscal year. And of that about 3.5 million, 2 million is being requested put into the reserve. Budget Unit 4121, Integrated Waste Management, is asking to lower their reserve by $10,000, and that's to pay for part of the community cleanup trailer. The other part was part of the cannabis grant that was requested. When I scroll through, is that too fast?
I'm good with it. If someone else needs you to slow down, please speak up.
Most of the rest are related to chip seal for roads, so specific projects pulling out reserves to take care of. So moving on to revenues. The first one there would be Budget Unit 1451, Register of Voters. They're requesting increase of $45,619 because they received a CTCL grant, and there would be associated appropriations to spend this money. Geothermal resource royalties, Budget Unit 1918. We're requesting $10,000 decrease in revenue, and what that is a transfer to Budget Unit 2703, which is animal control, which is then passed through to Budget Unit 2711, which is the animal control clinic, for salary increases due to the class and comp study that was approved by the board. And I already talked about Budget Unit 1920, but this is where you can see where the revenue asking to be lowered by $3,495,000. So originally we had appropriations of that same amount. The appropriations will be lowered by $2 million, and 1.495 would remain for projects like roads. Another one of significant note would be Budget Unit 2203, marijuana suppression. They received a $65,000 increase in revenue from the DEA, and they plan on using that for helicopter services. And Budget Unit 2301, jail facilities, actually has increased revenue as well of about $382,719. Part of that is from the local community corrections, which is realignment 2011, and CDCR funds, which is COVID for jails, COVID funds for jails. These next two are together, Budget Unit 2602 and 2702, Planning and Building and Safety. Building and Safety is asking to decrease their revenues by $900,000 as well as their appropriations. And Planning is asking to lower their revenues by $1 million and their appropriations by $1 million. That sounds astronomical, but it's all related to the Gwinnett Maha project, and the developer and the county, there has to be a third-party service paid for to oversee the developer. And instead of the county paying the third party directly, the agreement now is that the developer will pay the third party directly, which means we would not have the expense or the associated revenue. And and by the way, most of these changes, they're not major as a mid-year goes. It's standard reshuffling for the most part. Like Budget Unit 2704, usually around mid-year, we'll know what the new Homeland Security Grant funds will be. So that will be budgeted in revenue, and then the associated appropriations will also be requested budgeted. Now moving on to appropriations, which is usually the big item where People want to know where we're spending money and why we're increasing. Budget Unit 1011, Board of Supervisors is actually requesting through the admin office an increase of $2,500 in general fund due to the increased cost of health and life insurance. We moved as much money as we could from other accounts and was left with $2,500 needing. And that same kind of thing is for Budget Unit 1012, County Admin Office. The Board of Supervisors approved the salary study in fall 2020, which was implemented for the 12/1 payroll period. That necessitated an additional $77,000 in general fund contribution after we covered some of the cost internally as much as we could. So Buildings and Grounds, Budget Unit 1671 has a lot going on within their transactions, but they're only requesting an extra $10,000 in general fund dollars. And that's mainly actually for an emergency HVAC for the Lakeport Library. And they have a cannabis grant as well, but we've already gone through all of those. Budget Unit 2110, which is District Attorney, is also due to the class and comp study implementation requesting an extra $23,000 in general fund contribution. And they attempted to cover it internally, but were unable to. So this is probably a good time to state that there were about 3 to 5 budget units that are asking for extra general fund at this point to cover the class and comp study results. Most were able to take care of or handle the money internally due to salary savings from employees not being, positions not being hired, etc. But I wanted to warn you that when we go to recommended budget time, all departments are gonna ask for more general fund or more from their state and federal funds to cover salaries because they're gonna want every single one of their FTEs covered, which makes sense. Sheriff Coroner is related to the CAN grant. And here's where Budget Unit 2201 is where outside the CAN grant, they're also asking for an additional $210,000 from the Cannabis Fund. And what this is for is they're calling it P25 radios, where their current cruiser radios don't meet the code. These ones will bring them up to meeting the codes that are required for them for security. And that's actually for used items. It's over $600,000 if we do brand new. I think that will cover most of the appropriations before I go into capital assets and position allocation, unless you guys have questions.
I do have anybody have questions? I have a quick question. I know it's been a discussion, at least mainly between Supervisor Simon and myself, since it's mostly dedicated to our districts, the ability to cash out on transportation, but it also covers the rest of the supervisors. Is that been used this year? Because I can't imagine us cashing in on any transportation this year, and that has $4,000 allocated. Do you have to take from general fund to pay for the extra health insurance, or can you borrow from there?
Okay, I will go into very specifically Budget Unit 1011 and how we came to the $2,500 needed. So the actual increase in healthcare insurance was $10,000.
Oh, gotcha.
And the reason for that is the county puts $1,000 per month towards if you have insurance. And previously, some either opt out or don't take insurance. There's an extra supervisor now receiving insurance. So we lowered 2270, which is supplies. I'm drawing a blank. Supplies by 1,000, 2950 for travel by 3,500, 2830, which is also partially travel, $2,000. So yes, we lowered plenty of other accounts. 2270 to try and cover it.
Okay, I appreciate it.
And Mr. Chair, just to further clarify, based on the commitment your board made a year or two ago, that supervisors would not charge mileage, no supervisor has done so since.
No. Agreed.
Thank you.
Okay.
That looks like we have no questions from the board, so let's go ahead and move on, and we'll open it up to the public once you're done with your presentation.
So I'll go to capital assets first, because there's going to be a decent amount of conversation within position allocation. So within the capital assets, you'll see quite a few CAN grants. One of the ones that I want to bring out is Budget Unit 1920, Disaster Response and Recovery. That's where the new jail generator cost is being paid from. And we've increased the amount, requested the increase to match what the current estimate is of $515,000, so giving an extra $10,000 possible for adjustments within that purchase. And then, let's see, Sheriff Coroner, you will see the radios. Those are considered a capital asset. Jail facilities, new kitchen equipment, $62,000. And in this column, you'll see new or increase or decrease depending on from the original budget, the final budget.
If I may interrupt real quick,
absolutely.
The jail, no, the Sheriff Coroner one, is that the one that's going through potential cannabis funding?
Correct.
Okay.
So I might want to bring up how that works. So Budget Unit 1072, which is cannabis, we don't actually pay anything from that budget unit. The way any of those work is the department will have the appropriation, so the expense in their budget unit, but they'll have another account that will be reimbursed from the cannabis fund. And one thing I didn't bring up also was Budget Unit 2603, Code Enforcement. They're part of the Prop 64 cannabis grant funds, and they're buying a 4x4 truck for cannabis abatement. Another actual notable one is Budget Unit 2703, Animal Care and Control. They had a generator installed back in 1920. We received a really late invoice. So
fiscal year 1920, because I got thrown off there.
Oh yeah, sorry, what did I say?
You said 1920, and I went back to a very different era.
Or budget unit, so I apologize. Fiscal year 1920, which we thought was all complete, well, we received a really late invoice, so it's requesting an increase to the generator of $30,000, which is a general fund request, which at the time was approved for, I believe, $60,000 to $75,000, and we paid everything that was available at the time. And that's all I have to say about capital assets. Are there any questions about capital assets? Because these are very specifically approved by the board.
No? Okay. Doesn't look like we have any comment. Go ahead and keep it going.
Let's see. Okay, so staffing. The requested adjustments for staffing is actually quite significant compared to normal mid-year budget times. I'm going to go through each and every one of them, actually. So Budget Unit 1920, Disaster Response and Recovery, is actually asking for a new Accountant Auditor 1-2 Senior. They only have one position currently, and they have 12 disasters to deal with. So they're requesting the extra staffing help. And that position would not be paid by general fund. It would be paid by disaster funds, admin fees, et cetera, that come from those. The next one in line would be Budget Unit 2201, the Sheriff Coroner. That is the new Deputy Sheriff Sergeant that's cannabis grant related. Budget Unit 2301, Facilities, Jail Facilities. They're requesting to lower a standard facility maintenance worker 123 and traded out with a correctional facilities maintenance worker. That one, the difference, there's a slight difference in pay. The facility maintenance worker technician pays the same as the correctional technician. The next one in line is Budget Unit 2707, Recorder's Office. They're requesting the addition of a limited term supervising a deputy assessor recorder. So this wouldn't be on their permanent allocation. It would be a subset of a known limited term of 1 year right now. That at budget times, they can request to increase that or decrease that amount. But currently, I have it as a request for 1 year. That one, they planned on not filling another position so that there isn't a major difference in general fund costs at all. They're not asking for additional general fund to cover this. Next up is 4011, Public Health. This position, Public Health Emergency Preparedness Program Coordinator, has been in the position allocation for multiple years now, and somehow it was removed by both the department and not caught by admin. So that's a filled position that needs to be put back. And I would like to make note that I need to ask for 2 adjustments on the attachment to the resolution. So when it's approved, please remove the line item for -1 Health Programs Coordinator. It's going to stay at 6, which there was a December resolution that brought it up to 6 in the first place. Moving on to Budget Unit 4014, Behavioral Health, there's quite a bit of change here. They're requesting to remove 2 mental health specialists, 1-2 senior mental health specialist SAC, 1-2 senior, remove 1 business software analyst, add 5 prevention specialists, 1-2, add 2 mental health case managers, 1 staff services analyst, and 4 client support assistants. Now, to put that in perspective, they did not actually ask for any additional appropriations, which tells me that they feel that they can cover it with their internal salary savings from these positions that they're lowering, as well as salary savings that they've already incurred from unfilled positions. Budget Unit 4015, Alcohol and Other Drug Services, or SUDS, Substance Abuse Disorder Services, is requesting to remove 1 office services supervisor, 1 office assistant. And here is my second request of a change on the attachment to the resolution. Please remove the 0.5 compliance review technician. I was told by HR that that position is actually filled, so you cannot remove it.
That would be weird.
Yeah, that wouldn't go well, right? Next up would be Budget Unit 6022, which is the library. And this is all cannabis grant related. So it's a little bit difficult to explain, but 3 positions were part-time. They're making them full-time, and they're adding 5 library assistants is the best way I can summarize that. And if I'm wrong, Christopher will, I'm sure, talk about it. But that's how I have it. So adding 0.2 to 2 library assistant, 1-2 technicians, adding 0.25 to a branch library coordinator, and then adding 5 new library assistants. And then moving on to Budget Unit 8695, which is Special Districts Administration. They're requesting to add 1 Special Districts Customer Service Supervisor. And there is also no additional appropriations requested, so that means they feel that there is salary savings to cover it currently. Finally, Budget Unit 8804, which is Children and Families First Commission, First 5. Their board approved the hiring of a new position, Health Program Support Specialist 1-2. Their actual position allocation is approved by your board. So here's the request of adding one position to their budget unit. And that is all I have for now.
I have a quick clarification question. You said on the attachments, and I'm reviewing the attachment for public health, you said health programs coordinator, which on the attachment shows 5 to 4, but you said it should say 6 and remain at 6.
Just delete that line.
Oh, delete the line entirely? No change, basically.
Yeah, that's a key piece that I'm going to change next year. This year and a couple of years previous, I'm only showing you the adjustments. It has been made clear to me that that's not clear enough for you, the board, to understand, to where I'll put their entire allocation next time instead of just the adjustment.
Okay. Any comments or questions from the board on Mr. Carter's presentation? Okay, I have a question. I know that we've discussed our, what I don't like the name of, but our fiscal crisis management plan, where we're supposed to reduce the number of allocated positions. And here we're adding almost 10. Now, granted, a large portion of that comes from cannabis. But again, as I've pointed in the past, there's the dangers that eventually general fund will be looked at to see if we can cover that. How do we, how does that fit within that fiscal crisis management plan in what we see today, where we have a very, I believe the total is an increase of 10. Am I correct on that?
Total increase. I didn't actually add that up.
I added it up yesterday. I don't have it.
If I could respond to that, the majority of position changes are in self-funded departments. The fiscal crisis management plan proposed salary, position reductions were in general fund departments. But with that said, it's certainly time to give another look to the fiscal crisis management plan. Our office has been talking about that. We are at a different place than we were when that was put together. And just as soon as time allows, we've all been somewhat scattered supporting the disaster response, but it's definitely something that needs a look.
Okay, thank you for that. So other than the library, which is all CAN grant perspective, we're looking at 4 total general fund positions between the disaster response recovery, the sheriff coroner, the recorder, and public health.
Disaster is actually not general fund. It's budget unit fund 110. So
and
it's sheriff.
Health.
What's that?
And maybe not public health either.
No.
Yeah.
It would be 2201, 2301, and 2707.
Well, except that the sheriff positions are CAN grant.
Okay.
And one of them just switched instead.
And one of them is just a flip. So really the only true general fund impact there is the recorder's 1-year limited term position.
Okay. Do we know what that financial impact looks like?
He told me that he's going to take care of it internally, which means no extra general fund.
That's right. That's right. You had mentioned that. Okay. Okay. Those were my questions on that. Any further comments or questions from the board before we open it up for the public? Okay, let's go ahead. Jake, let's go ahead and please open up the Zoom room for any public comment on this latest presentation, our mid-year budget review.
All right, I've sent an unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Okay, hearing none, let's go ahead and bring it back to the board. I believe that is the final of our presentations for the mid-year budget review. And so let me just go back to our agenda because we had an A and a B. Excuse me. So we're looking for approval of resolution amending resolution number 2020-133. And then the allocation position approval as well. So looking for action from the board.
Chair. So I'll go ahead and offer the resolution, and I know that I advocated heavily for law enforcement, et cetera, and I'm not going to belabor anything, but I just want to let you know that I'm not going to be a stick in the mud and vote no, because I think all of these things are important and I want to make sure it happens. So I argue my hardest, but I want to offer and be a part of this solution. So I offer the resolution.
Appreciate it. Johanna, roll call, please.
Okay, Supervisor Simon,
Yes.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
And then looking for the next resolution for position allocations.
I'll offer that resolution as well.
With changes.
With specific changes noted by Stephen Carter.
Which would be to remove the 0.5 compliance review technician and deleting the healthcare programs coordinator line entirely.
Correct.
Johanna, roll call, please.
Okay, Supervisor Simon,
Yes.
Supervisor Crandall,
Yes.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
All right, thank you, everybody. It is 12:06 right now. We are done with our timed items. I'm looking, we still have a bunch of untimed items and then closed session. I'm thinking we take a lunch break right now. What do you guys think? Are you all in favor for taking a 30-minute lunch?
Yes.
So let's meet back here. Let's do 12, let's give time for staff. Let's come back at 12:45. Oh, Ms.
I
Hutchinson.
think Carol has a comment.
Yeah, just real quickly, in case anybody is here for item 7.5, there has been a request to pull that item today. So I would hate for somebody to wait through the lunch hour and return if you want to make that announcement, Mr. Chair.
Yeah, thank you so much for reminding me of that. You mentioned it this morning, so we will take that up hopefully in one of our future agendas sooner than later. Okay, we will adjourn for the moment, take a recess and lunch, and we'll be back at 12:45.